everyone. Hope everyone's having a fantastic morning, afternoon, or evening, depending where you are. I changed the decor. I put up a new... I downloaded a new wallpaper, I guess. Hi, welcome in Saf, and welcome in Diggs. Hope you guys are having a fantastic one. Pretty easy Monday. Hope everyone's having a good Monday. And we're doing, like... You might notice that things have changed, like, slightly in the coloring department on my overlays, and that is because this weekend, like, instead of streaming, I decided to, like, fool around a little bit, because I was low-key unhappy with, like, the look of some of my stuff, so I was like, I'm gonna fool with some things. So, new chat box, new background in general for the overlays, so I'm happy. And also, while I wasn't streaming, I hit 169 followers. We met the goal. So I'd like to thank everyone for following and stuff. I didn't expect to get to 169, but for some reason I am very cursed where every time I hit a 69, I'm not online. So like, no wait, like when we hit 69 followers, I was streaming, but immediately, like, the second I got 69 followers, someone else followed too, so I was like, damn it! I can't live with my 69. But, it's now 170, yes. So, I hit 169, like, right after I streamed last time, and then I was like, oh, like, I'll say something when I stream next, and then I got another one, so, but yeah, thank you. I guess I gotta put up a new goal or something. I wonder if this will change it. But I'm gonna start a new one. We're gonna alright, next goal, which I'm not sure when we'll hit it, but our next goal is 269, because god damn it, one day I actually want to hit that 69 and let it sit there for a little while. So that's our new goal, which I'm not sure when we'll hit it, but yeah. I don't have any celebrations for follower goals. The only follower goals celebration I have is for 404. If we hit 404, which god, that's too many people. But if we hit 404, I'm gonna do a karaoke stream, so that's the only thing I have. If any, I don't have ideas for milestone streams other than that, so, you know. But yeah, thank you guys again for so many follows and stuff. Appreciate it. But yeah, but otherwise been chill. Usually I think of like things to talk about in the pre-stream, but now I'm like drawing a blank. And, like, I think I thought of something earlier, but then it just left me, I guess. I mean... Well, lately I've been playing some visual novels on the side, so that's been fun. Like, I've been in a bad habit of buying a lot of visual novels and not playing them, so now I'm like, okay, I actually gotta play them this time. So I'm actually starting on one of them, which you might see in the future. Then I'm gonna play something else once I'm done with that one, because I'm like, okay, I can't play any visual novels until I finish the ones that I've already got, and now I am stuck here and it's hell. But anyway, what we're gonna be playing today is one more Trauma Team, which very exciting because for the past few Trauma Team streams, we haven't met two of our characters. We've only been playing through 4 of them. So today we're actually going to meet our last 2 doctors, which funnily enough are both the surgical ones. So Trauma Center, the series, is known for being like big into surgery, like the really difficult surgery stuff. We haven't technically done any of the traditional Trauma Center gameplay yet. But today we're gonna actually get into that, and it's gonna be nice. So let's just switch over and unmute the game. And as always, when I'm doing Trauma Center streams, please let me know if the audio is good. It is obnoxiously louder than anything else I stream, so it's a little difficult. So first up for today, we're actually gonna meet. We're gonna do 2 events, and then we're gonna get into like actual gameplay. But we're gonna meet Maria. Yeah, that's how she pronounces it. But She is our first responder, which it's technically surgery, but like with a twist in it. So let's meet her. All right. I think this is fan servicey one, right? This is fan servicey BN. Okay, this is the fan servicey. Yep. 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 Twitch don't look. We got some side boob there. Yep. Hi, Maria.
Torres here. Oh, hey, Chief.
Maria, a fire's broken out on 14th. Get there and hurry.
Why are you calling me? I'm off duty.
Everyone else is out right now. Stop complaining and go.
Ugh, all right, but I better see a bonus next payday.
Does she... Wait, does Maria live in like a fucking... Does she live in a storage unit? Oh god. There she goes.
Come on, out of my way!
The myth, the legend, the Maria. Anyway. So next up is actually, at the same time this is happening, we also have, our surgeon, a CRSO1. Let's meet him.
Open the door. He wants to talk to the prisoner.
What?
The
Guy
prisoner?
with a 250-year sentence? I wasn't informed of this.
What?
Here's my authorization from the HHS. Any problems?
You want him to perform surgery?
I'm sure he won't say a word. He doesn't remember anything.
Why is there a surgeon a felon? Why can't he remember anything? Does he remember how to do surgery? That's what I'm concerned about as well. Hi. Hello, surgeon.
It's been a while.
Hi. What a man, everybody.
What do you want?
You're needed for an operation.
What?
In exchange for a reduced sentence.
What?
You want me to operate?
You want him to operate?
That's right. Here are the details if you want to see him. Take your time. Think it over. But remember, you'll never have another opportunity to save lives.
Does he have to do surgery handcuffs?
Lives.
Why is he in a freezer?
Again.
Okay. Anyway, that was weird. We're gonna go over to Maria. For those of you joining me, like, I'm doing this in a chronological order that I am, like following. So, like, it's actually in this order where I'm, like, jumping between, like, 2 different scenes and stuff. Like, let's see what Maria's up to.
Almost there. Just hang on. Good.
Hey, you! Has everybody been rescued?
Who the?
I'm with Resurgam First Care. Tell me what's going on.
A fire broke out in the power facility. It's being contained.
Oh. Oh, shit.
Damn, that was a big one.
you going?
All right.
Hey, you okay? What happened?
We had a backdraft. Two of the people inside were hit by it.
They need immediate treatment. Move them over here if you can.
All right. Fire outbreak at a power distribution facility. Currently spreading. Backup has been requested. So we initially have 2 initial victims. Hi Herbert, how you doing? Hope you're having a fantastic one. A fire broke out and now we're in first responder. Let's go. Monoxide poisoning in 3 minutes. Stat.
All right, beginning treatment.
Okay, so first responder, it is played like traditional. It's played like traditional trauma center, except that you actually have multiple patients that you need to take care of. So you need to like balance between all these different patients and make sure they don't die. And you're actually graded on how many people don't die. So let's go. Emergency response. Switch between patients to treat and transport as many as possible. Emergency rules. If you do not save enough patients, then you will fail.
Hemorrhaging's pretty bad. I gotta treat that blood pool first.
Using additional tools. Point at the tool in the lower right and press A. Using gauze. Hold A on the blood to absorb the hemorrhaging.
Hey, damn it, this gauze is soaked through. I need a new piece.
Alright.
Blood pools have been treated. Let's get a look at the abdomen next. There's burns too. I gotta anesthetize him with the antibiotic gel.
Okay.
That's not enough. Okay, spread.
Right, about the tran left. Use the forceps to hold. Okay.
Okay, now to saturate the gauze, alright? Once
Alright, use tape.
I have to make sure the tape goes straight across the good. Moving on
Yay.
to the next section.
Oh. Oh, Herbert. Oh, I'm so sorry. I forgot to turn that off. Okay. Actually, I have to refund you, Herbert. That is for Code Realize streams. So, let me... How do I don't know how to refund, but I will do that after stream. Actually... Yeah, that's for strictly for Code Realize streams, so I forgot to turn it off. Let me just... Like, this guy's dying, but, you know... Actually, wait, I should probably... heal this man and wait for a cutscene. Okay. Oop. 1010, how do I refund? I don't know how to refund these. I know that people have done it before, but let me turn that redeem off. There we go. Alright. Cool. Alright. So it's turned off. There we go. Hey Chip, how you doing? Hope you're having a fantastic one. My chat also reset, so I didn't see, and I lost all my chat logs for setting that, but
Vitals are getting low. I should use the syringe to
save him. I need to. Okay, drawing up the medicine. Okay, let's go.
All right, he'll be okay for now.
I gotta save them. There's 2 of them here. Thomas.
Oh yeah, there's another wounded person. I should take a look at her too.
Alright, switching patient. Okay, got the refund. Thank you, 1010. I appreciate it. Points to the tags at the top and to say, okay. Yo, switching treatment.
Someone's got burns too.
Alright. Let's get all these guys out. Ah.
Okay, cool. Things are going well. Hang in there, okay? What's with these convulsions?
Oh god.
Damn, cardiac arrest. Starting chest compression.
Thomas, thank you. No! Alright. We gotta whack this guy. Ah!
That's it. You get back here. The pulse is
All right.
returned. I'll need to secure an airway. Use the laryngeal mask.
Oh god. We gotta keep people not dying.
Straight into a respiratory truck without bending it.
Alright. Grab the end of the sheet. Okay. Gotta shove it in.
This there. Rescue complete.
This must be a toy. Ah. Stabilize. Alright, we healed one of them. Alright. Oh. I killed him by dropping the fucking gauze. Alright.
Alright, done. The burns have been treated. Better do a blood transfusion just in case. First, to disinfect the area. Where's that ab? I have to secure an intravenous path with the cannula. There we go. Now to bandage it in place.
Alright.
Okay, just
Ah! Alright.
complete. Alright, transport this guy.
Would
out
have Humphrey appeared. Oh god.
Is that all the wounded taken care of? Alright, mission complete.
Alright, stabilize. We saved 2 people. I think this is the one mode in the game where people can actually die and you can still win the game. Rank B.
Alright, I'm on a roll today.
Alright. We did it, guys. We saved the day.
Alright, that's all the patients.
Hey, you!
Huh? Oh, are you guys done here too?
Who do you think you are, barking out orders like that? Disasters require strict adherence to the chain of command. If you disrupt the team's coordination, you're hurting us.
What did you just say? I was called here because you obviously couldn't handle...
Hey, are you spacing out?
Hi?
I get it. You're Maria Torres from Resurga.
What?
Yeah, I've heard about you.
Maria? You okay?
Have you heard a single word I've been saying? You're not helping.
She's
You're a
seeing
nuisance.
things. Oh no.
Shut up.
Oh!
And then she killed a man.
Damn right I'll order you around. I'm the best one here. If cooperating is so important to you, then do what I say. Later, asshole.
Anyway, let's not think about that. Alright. Alright, our next operation is actually back to Gabriel. So let's see what he's up to. Let's diagnose someone else. Oh, butterflies. Cute. Oh, hi, Hank. We haven't seen you in a while.
Hey, Hank. What? So you're the one who takes care of the flowers?
Oh, Hank.
I'll be.
They enjoy flowers. You give them love, and they blossom.
So different from humans. So, what'd you need me for?
Moving heart.
Could you take a look? This condition is a strange one.
So, what's with all the fuss today?
Well, you haven't heard? Someone's doing an OLCVR today.
You're kidding, right? No one does that procedure anymore.
I'll be assisting. A specialist coming in for it.
A specialist? Who's
It's
that?
one of your patients, you know.
Mine? Don't tell me.
Hey, out of the way! Let me through! It's all right, man. I thought you'd come.
Oh, it's you, asshole.
So, it is you. An OLCVR? What are you thinking? You told me yourself that you're the doctor, right?
Yeah, I may have said something along those lines. So?
I may be a
you're
doctor.
The doctor, and I'm the politician.
Okay.
Well, it's my duty to lead this country, even if my life's at risk.
Can you, like, calm down?
But do you have any idea what kind of operation this is? It's outdated and it won't cure you. It's just a stall.
Ha! You afraid? You were so strong before, preaching at me. But son, you don't get to my age being as timid as you are. One thing I've learned over the years, never give up.
Damn. That's one determined old fool.
Welcome,
Oof.
Doctor. Let's begin today's diagnosis. The patient, Shelley Brooks, claims to have a fever. Dr. Cunningham, are you listening?
Yeah, listen, Edie. You're in the middle of your romance arc with your robot, like,
Yeah.
like Mass Effect.
Your concentration is low. You may overlook something critical.
Huh? What are you talking about? It's not gonna happen.
Does Assistant Secretary Tillman's operation weigh heavily on your mind?
Shut up.
See, they're
Not it.
bonding now. The true romance of video games is between a man and his computer.
I'm sorry, Doctor, but if you are troubled, I am equipped to listen.
They even gave you a consultation function, huh?
No, but I can supply template responses to match your mood.
Yeah, that's just pity comfort. Come on, let's start the diagnosis.
Understood, Doctor. I am now opening the patient's chart.
Okay, so we have Shelley Brooks, age 28, gender female. The patient is a stockbroker previously treated for chronic renal failure. She's admitted for an unusually long cold. Alright, let's start. Gotta get her big brains out for this one.
Hello. I'm glad that someone could see me.
Not a problem. Now, to begin with,
I'm sorry, Doctor, but I have to attend an important business deal soon. Is it possible to keep this as quick as you can, please?
well, I wasn't planning on wasting time. Roni, are you ready?
Yes, Doctor.
All right, let's start the diagnosis.
Alright. So, she's very pretty. Like, doctor, aren't you gonna ask what kind of symptoms I have? No, sorry, you're really pretty. Oh, sorry. Let's first begin with a consultation. Yeah, please, I'm in a bit of a hurry. Alright.
I think it's just a cold. Can you prescribe me something so I can get back to work? You can't? Oh dear. This isn't good. I've got a meeting soon.
I mean, don't you know the deal? If you ever go to the doctor, you need to, like, plan, like, 2 hours around it. Because, holy shit, it can last forever.
I've had a fever for a while and it won't go away.
A continuous fever, huh? Perhaps... Excuse me, but are you married?
Dr. Cunningham, this isn't what you should ask.
Doctor, is that relevant to my illness?
Yeah, is it relevant, Dr. Cunningham?
Well, there's no direct relevance, but a woman's body temperature increases during pregnancy. We see a lot of women who think it's a fever.
Oh, okay. Makes sense.
Well, thank you for thinking about that. Nope, you don't have to worry about that. I'm totally concentrating on my job now.
I see. Then let's make a note of this, Roni.
Understood, Doctor. New symptom observed.
Okay, so he's actually being thoughtful. Okay. That's actually smart. Okay.
I've also lost some weight, but I think it's just because of the fever.
Weight loss. Whether this is a symptom or not depends on how much you lost. So, what was your original weight, and what is it now?
I don't really want to mention how much.
This is your doctor, ma'am.
Okay. You don't have to be specific. Ballpark.
Well, it seems like a lot. Like, it's more than should be natural.
Okay.
I see. I appreciate your cooperation. Roni, jot that down.
Understood, Doctor. New symptom observed. Weight loss.
Besides that,
night
I've been
sweats.
having night sweats, but that might be the fever too.
Night sweats, huh? Dysautonomia is the first thing to come to mind, but... You've been busy with work, right? Does it stress you out?
Stress? That's a good one, Doctor. I love my job.
That's a lie that the capitalism tells you, sweetie.
You're a strange one. If I had my pick, I'd be sitting on my couch all day.
That's the spirit, Dr. Cunningham.
That's not relevant, Doctor.
It is relevant.
Observed. Night sweats.
Night sweats.
Sheesh. Enough already. You're starting to sound like my wife.
I can't think of anything other than those. Oh, I wasn't trying to hide this or anything, but I had an operation 2 months ago. It wasn't at this hospital. I had some kidney trouble and received a transplant.
Okay, I think we need to write that down. Damn it. Okay.
There's some odd bruises
Oh,
around
okay.
the scar from the
I was a little too
operation.
hasty.
Bruises. Around the operation scar? That worries me a little. Could you tell me in detail where they are and what they look like?
Oh yes, of course. The scar from the transplant healed cleanly, so there isn't much of it left. But there are these black bruise-like things around where it was.
Huh.
I'll need to look at it in detail. Would you mind showing me later?
Yes, if you need to see it for the examination, I understand. It's strange. I made sure to take the medication they gave me too. But that's it really. See? It's just a cold, right?
Yeah, mysterious bruises? Nah, just a cold, right?
Abnormalities around the operation scar, huh? Well, let's see them.
Alright. Now that I need to check the area around the surgical scar. Time to perform a visual exam on her abdomen. I'm gonna have to look at your abdomen. Will you please lift up your shirt for me, please? Ah! Those are dots, ma'am. That must be the scar from her kidney transplant. That's weird.
It's true there are dark red pigment spots around the operation scar.
Those are like specks. That's not normal.
Did these exist before the kidney transplant?
No, I'm sure of it. I'd have noticed if those were there before.
Did you show these to your doctor? What did he say about them?
This is the first time I've seen a doctor since the operation.
Not even for post-op?
I've been so busy at work,
I
couldn't keep any appointments.
You need to go to your post-ops, ma'am.
I see. And this needs to be examined. Roni, I'll need a scintigraphy and a biopsy done.
Understood, Doctor. Since biopsies are done in the pathology department, it will take some time. Is this acceptable?
If it's not in our department, I can't tell them to do it right away. Just let me know when the results come back, Roni.
Understood, Doctor. New symptom observed. Pigment spots. Also, the scintigraphy is ready.
Pigment spots. Hey, that's all that seems off right there. Like, I'm not noticing anything else visually about her. Because nothing's trembling. Like, and nothing seems off. Alright. Okay, so let's... Okay, that sounds normal. Okay, that sounds normal. Alright. Okay, that all checks out. Alright, so let's look at the Is it a scan or?
Doctor, the
Okay,
results from the
scintigraphy.
scientific exam are
Cool.
ready.
I know. I came here to check them.
Okay. Doctor, this image that has been taken. It is the patient's thallium intake in the entire body. It's right time to check it out. Okay. Okay, there's an extra spot down here. That body. that body looking a little fucked up over here.
So, the uptake of thallium matches the pigment spots on the skin. There's a good chance the pigment spots are tumors. We should review our diagnosis candidates.
Understood, Doctor. New symptom observed. Abnormal uptake into pigment spots.
Okay. I'm not seeing anything else that's abnormal, because it's not showing from the back. It's only coming from the front, which is where the skin be. Alright. Alright, let's see. Pityriasis rosea? Disease in which inflammation occurs along long patches of oval-shaped rashes on the skin. Red pigment spots. Oh. Red pigment spots appear in the inflammations. Skin conditions are often confused with lack of appetite. She doesn't have a lack of appetite, she just has weight loss. I don't think this is it, but I'll like still put these in. Because we only have fever and she doesn't have any joint pain. So, skin disease caused by viruses. An outbreak of this is accompanied by an appearance of symmetrical on both sides. Okay, that's gonna knock this out. Malignant melanoma? Oh, melanoma. Pigment spots. Like, it doesn't explain anything else, though. Kaposi sarcoma, a type of malignant skin tumor caused by human herpes virus 8. Fever, weight loss, and night sweats. Visual exam will confirm the presence of pigment spots. Uh-oh. A scintigraphy will find an abnormal uptake in areas with heavy pigmentation. Uh-oh.
Kaposi sarcoma? All our symptoms apply to it, but...
Doctor, are you concerned about something?
There's no way Kaposi sarcoma occurs unless there was an extreme decrease in the immune system.
Okay, so disease only appears in humans when an extreme decrease in the immune system has occurred due to AIDS and other immunocompromised stuff. Okay. So if she doesn't have AIDS or any like immunodeficiency disorder, that's probably not it.
If we don't solve that portion, it's impossible to make a diagnosis. I feel like it's right there in front of me. Roni, do you remember anything that might help?
Negative, Doctor. I record only pertinent facts in my memory. Would you like to change these settings so that I record every detail of the diagnosis?
No, let's not. I feel like I'd be cutting off all my escape routes if I did that. Oh well, I think it's time to listen to what the patient has to say again.
Alright. I mean, we can see if it's influenza. She has a fever, weight loss, and night sweats, and that's it. Alright. Let's talk to her again.
Sorry to keep you waiting when you're so busy. How are you feeling?
Nothing much has changed in particular. Is this gonna take long?
Don't get so hasty. It's going to take a little more time until you're diagnosed.
I see. I've got a meeting soon, though.
Okay.
I think it's just a cold. Can you... You can? Oh dear. This isn't good. I've also lost some weight, but I think it's just... Besides that, I can't think... Oh, but I had some kidney trouble and received a transplant.
Okay.
There's some It's strange, but that's it, really.
There's something that bothers me. A severely inhibited immune system is per. Okay, I'm actually gonna go and save real quick. Just in case. Let's save. I think it's the kidney transplant that it's gonna... Yeah, heck yeah, save. If I ever, like...
Sorry to keep...
Nothing...
If I ever die in trauma team, it's because of the fucking diagnostics, because... Like, I like questioning everything, and usually if you question wrong, you get killed by Edie.
I've also... I can't... Oh, but I had an operation too. I had some
kidney transplant? Okay, this isn't it. Alright. An operation? This is where I'm, like, throwing everything at the wall.
There's some odd... It's strange.
I can't be so hasty.
Oh, the medication.
The medication prescribed after the kidney transplant.
Okay.
Hey, I'm sorry, but can I confirm something? You were given immunosuppressive drugs, right?
Yes. Isn't that something normal to take after an organ transplant?
Yeah, that's right. But that's something we need to know in making a diagnosis. Now, everything depends on the results of your biopsy.
Okay. We did it.
Dr. Cunningham, the biopsy results have come back from the pathology department.
Finally. How are they?
The antibody reaction was positive, but they failed to specify the virus causing the disease.
Failed to specify the virus? What in the world are they doing?
Not doing their jobs.
Unknown, Doctor. Shall I explain the 1,874 patterns of conjectures in regards to it?
What? No, that's all right. It shouldn't be a problem to make a diagnosis. Roni, let's go back to the office. Time to narrow down our possible candidates.
Understood, Doctor. New symptom observed. Positive antibody reaction.
Alright, positive antibody reaction. And now we're down to 2 health, because I didn't know what he was talking about.
So, we have all the symptoms. It's diagnosis time.
Okay, so we have... So... a positive antibody reaction. There we go. Kaposi's sarcoma.
So it is Kaposi's sarcoma. But why? The period of time until the onset is too short. It's similar to Kaposi's sarcoma. This is something else.
Doctor, we have an urgent contact. Please head immediately to the examination.
Okay.
The patient has come to the hospital complaining of abdominal pains.
Huh.
All right, I'm on my way. Abrupt stomach pain. What on earth is going on?
Doctor, these may be related to the tumors discovered before.
Great. Roni, you ready?
Yes, Doctor. Commence diagnosis when you are ready.
All right. Reserve an OR just in case. Let's begin.
Understood, Doctor. I bid you good luck.
Alright, patient was diagnosed with Kaposi's sarcoma, but the onset occurred very quickly. Readmitted for abdominal pain. So, new symptoms. Phase 2.
Hey, are you all right? What's wrong?
Oh, well, I went to work, but my stomach started hurting all of a sudden.
There's a chance your condition took a turn for the worse. Roni, get ready for examination.
Yes, Doctor. Begin when you are ready.
Alright, so new round of questioning. We gotta do everything else.
My stomach suddenly started hurting.
Yeah, that's weird.
I see. So these are the sudden abdominal pains you mentioned earlier. Roni, make a note of it.
Understood, Doctor. New symptom observed. Stomachache.
And...
Oh.
I feel a little nauseous, too.
least she's being honest with us.
She's experiencing nausea as well. This is far from being good. Roni, make sure you're getting all this.
Understood, Doctor. New symptom observed. Nausea.
I can't concentrate on my work with this going on. Please, Doctor, see if there's anything wrong with me. I've told you everything I've been feeling. Let's see if there's anything else.
Bloated.
I guess I have been feeling, a little bloated.
See, her abdomen is bloated then. Roni, add that to her record.
Understood, Doctor. New symptom observed. Bloated abdomen.
Lately, I haven't been able to, I'm having trouble using the toilet fully. You understand?
Oh, so you're constipated. Yay!
Trouble using the toilet fully? In other words, well, let's just be frank about it. It's nothing to be embarrassed about, right? We're animals. We excrete waste. Right. Well, I won't force you to say it then. But you're unable to produce those things on the toilet, yes?
Yes.
Great. Now we're getting somewhere. Roni, make a note of this.
Understood, Doctor. New symptom observed. Constipation.
she like they're both like dancing around the subject, and the computer just like, ah yes, you have constipation. Let me jot that down. Okay. Okay, stethoscope. Okay, make a note of the constipation, please. That doesn't sound like it's changed. It's probably gonna be the stomach, if anything. Okay. That's not that's not normal.
Your intestines' bowel sounds are a bit violent. Roni, write this down.
Violent is a very low way to put it.
Understood, Doctor. New symptom observed. Aggravated bowel sounds.
It looks like the bowels are about to stab me.
You know, given these symptoms, it appears to be a problem with the intestines. Roni, get approval for an X-ray and a CT exam.
I've already sent in the request, Doctor.
Good call. Maybe you should become a diagnostician.
With all due respect, Dr. Cunningham.
Yeah, I was just joking. Let's hurry up and get going.
Okay, so visual exam, which we already got those, so that's fine. But I don't think anything new popped up. Nothing shaking. Nothing looks off. Alright. Let's go to the office. Talk to the preparations for image analysis. Oh, because I need to go to the lab. Thank God I recovered all my hearts.
Doctor, the results of the X-ray and CT examinations are ready for you to look over.
Well, I guess I should look them over.
Alright. Let's look at our X-ray. Is that a phone? Does she have a phone inside of her? Like, oh no, doctor. She breathes in a phone. Oh no, it's fatal.
The fluid and gas in her intestine have completely separated. It's a NIVU, Roni, an air fluid level.
Understood, Doctor. New symptom observed. Formation of air fluid level.
You can just say it's a phone, guys. I don't have to use the scientific words. She has a phone in her lungs. Or intestines, I guess. Alright, I think that's it. Let's look at the CT exam. Doctor's a tomography image of the patient's abdomen. Alright. Let's see if there's anything. This one looks pretty okay from what I'm looking at. The thing that kind of sucks is that, like, normally I think actual doctors like put the images on top of each other to like directly see the differences, but huh. Alright. This thing is small.
Atrophying can be seen in the left and right kidneys. Hey, Roni, would you call this a symptom?
Negative, Doctor. The patient has received a kidney transplant.
Ah, that's right. I forgot the new kidneys were transplanted without extracting the diseased ones. Well, that means this symptom's already been treated.
Oh, okay, so this is normal.
Correct, Doctor. It does not need to be recorded as a symptom.
I guess you're right. I mean, I was just testing you. Keep up the good work.
I'm sorry, but I do not fully believe you, Doctor.
Hey, you could at least play along.
Okay, so we don't need to worry about those kidneys and stuff. But it doesn't look anything else is off. I'm like looking. Okay, let's check the next one. I'm not seeing anything too bad here. It looks the same. Yeah. Alright. Next one. I'm not seeing anything from the CT scans. Other than the kidneys, but that's normal. Oh, wait a minute. That's not normal.
Are these shadows in the small intestine tumors? It's hard to make a call. Roni, give me your opinion on this.
Doctor, I do not have any opinions. My answers are based on statistics.
I almost missed that.
Whatever. Just spill it.
I'm currently collating this data with tumor examples in my archives.
Last time I asked a machine for a quick answer.
My calculations show there is an approximately 92% chance that these are tumors.
Whoa! Anyways, yeah, so let's just call them tumors for now then.
We must not do that, Doctor. There remains an 8% probability that they are not tumors.
Yeah, and that pretty much means they're tumors. Well, just record the symptom for now.
Understood, Doctor. New symptom observed. Tumor shadows on small intestine.
Okay, so we got tumors. I think that's it. Alright.
We've gone through the X-ray and the CT scan. Let's head back to my office and sort it all out.
Alright.
I think we have everything we need to make a diagnosis, Roni.
I agree, Doctor.
It's so much easier when the patient's cooperative. Like, imagine a patient being cooperative with us. Okay. So we have acute hepatitis. I guess we'll start from the bottom, work our way up. Condition in which the liver cells cause an acute inflammation due to multiplication of hepatitis viruses within liver cells. Stomach pain, nausea. She doesn't have a loss of appetite, so we might have. Okay, she doesn't have jaundice. Okay, I can throw that one out. The condition that causes various symptoms due to a stone forming in the biliary tract. It's accompanied by symptoms such as stomach aches, nausea, fever she does have, lack of appetite. Again, she has an appetite, it seems. A condition in which the intestinal tube narrows or becomes blocked, obstructing the intestine. It is accompanied by symptoms such as stomach pain, nausea, constipation, and bloating. Well, aggravated bowel sounds, formation of air fluid level, and tumor shadows of the blockage will appear on the CT scan. Okay, so this looks like it's it.
intestinal ileus originating from tumors in the small intestine.
Due to the location, there is a high probability that the primary focus will be the ones on the skin.
Damn it. I know, but...
Doctor, I would recommend that you examine the other organs as well.
Yeah, I agree. Let's go back to the exam room.
Understood. I'll make
Alright, is this gonna be a round 3 one? Alright, round 3.
Metastasis spreading from skin tumors to the small intestine?
Yes, Doctor. At this rate, other organs are also in danger.
Ah, damn. Something isn't right, Roni. Let's hurry.
Yes, Doctor. I am ready to continue the examination.
Alright, tumors identified as an ileus. Metastasis of the tumors is expected. Continuing diagnosis. Tragic news, ma'am. You fucked.
Doctor, how is it? What am I ill with?
Everything.
I can't say for certain yet. Sorry, but I need to run more tests.
I understand. I have faith in you, Doctor. There's something I need to tell you.
Is it a new symptom?
Well, yes. Seriously, this cold season's been really tough recently, hasn't it?
You weren't coughing before, ma'am. Okay, let's question you.
I don't know why, but my chest's been hurting for a while.
That's new. None of your stuff was respiratory before.
Chest pains, huh? She looks like she's in a lot of pain. Roni, could you make a note of this?
Understood, Doctor. New symptom observed.
Like,
chest pains.
Like, she's fucked. Like, legitimately, like, this whole time we've been diagnosing her stomach issues and, like, all the tumor stuff going on in her stomach, but now she's having chest pain? That's another part of the thing. She's gonna die. Okay, I already get to that.
If this keeps
Oh god. Ma'am?
I'm sorry. Anyway, I won't be able to work if this continues.
Oh no, she got a new sprite of coughing.
I won't have to be hospitalized, will I, Doctor? I'd have to rearrange my schedule.
I think you have a little bit... You think you have to resort your priorities a little bit. Okay, let's check out the lungs. Okay. Huh, that actually sounds pretty good. Maybe you aren't completely fucked. Your lungs sound normal, ma'am. Yeah, heart does too. Yeah, that sounds normal. Hey, ma'am, your stomach sounds normal now. Maybe you have a chance. You have a chance. Your stomach sounds normal. Hey. All right, let's do the EKG. Okay. I'm always the worst. Oh, wait, what? Wait. Whoa. How do I pause this again? There we go. Alright, I'm gonna wait for that. There. What the hell is this?
Huh? What's this? The EKG's display is incomplete. Hey, Roni. The EKG seems to be glitching.
Performing physical repairs is beyond my powers. Please contact customer service.
Customer service, huh? Maybe they can fix how stubborn this thing is, too.
Did you say something, Dr. Cunningham?
Must be your imagination, Roni. Let's begin the diagnosis.
Okay, but what if it's not Dr. Cunningham? Okay, so everything up here should be going up. It looks normal. Other than that, like, blank spot, it looks fine. Like, it all should be kind of going... Yeah. Like, it's only that blank spot that's wrong. Oh. Okay. Well, let's do a visual check. Okay. Nothing has really changed. Like, I don't see any jaundice up here. She looks excited, but like, she's going to die, so I guess that's understandable. Okay. Is there any... Okay, no images. Let's start putting stuff in. Wait, is there more? There's more I need to like check up on. Let me save. So I need to like ask her more things?
Sorry to keep you waiting when you're so busy. Can I have a little more of your time?
I know. It can't be helped, but... Please try to be quick about it.
I understand. I'll have an answer as soon as possible.
Okay. I mean, is it a...
Why, but if this keeps up...
Cough. Alright, I need...
Seems to be
Yeah, I need to... Yeah.
Could it be her lungs or bronchi? Roni, let's record this too.
Understood, Doctor. New symptom observed. Coughing.
Okay, that's why I was missing.
I won't have...
Oh god.
Are you alright? If you're not feeling well, we do have beds ready.
Oh no. It just seems like the chest pains are getting worse.
Her symptoms are getting worse. We need to redo all the exams.
Understood, Doctor. I'll make the preparations.
Okay. She's getting worse, so I need to check again. Okay, these thankfully sound... Oh, right lung not doing so good, ma'am.
These respiratory sounds are weak. What about in other areas? As I thought, the other areas are normal. They're only weak in the lower left lung.
That's where the phone was. The phone was here.
It's some form of lung abnormality, for sure. Roni, get approval for an X-ray exam. We need it done right away.
Understood, Doctor. The X-ray exam is now available. New symptom observed. Attenuation of respiratory sounds.
Okay, well, I mean, you got one lung, one working lung, ma'am. And your heart's still going good. Like, you have hope. And your tom-tom's still doing good. Like, maybe things aren't so bad. Okay, let's look at the EKG again. Okay, that thing's still here. I'm not seeing anything that's abnormal except for that blank spot. Okay, let's talk to her more.
When I was coughing just now, I tasted blood.
Uh-oh. This woman is deteriorating before her eyes.
Tasted blood. This isn't good. Roni, add bloody sputum to the list.
Understood, Doctor. New symptom observed. Bloody sputum.
Things are getting worse.
I can't believe this. I had the kidney transplant. My life was going well. Doctor?
Oh no.
It's getting hard to breathe.
She is going to die. Exactly. Like, holy shit. It's getting worse and worse.
Suffering from a mild case of dyspnea. Roni, you got that one?
Understood, Doctor. New symptom observed. Dyspnea.
Okay. Ma'am. Okay, well, we got those, let's look at the things.
Doctor, the patient's X-ray images are ready for viewing.
I like how, like, this woman is dying in front of us, but we still have the smooth jazz carrying us along the way. Like, she's dying, but who cares? Let's vibe.
Sounds good. Let's see him.
That lung don't look so good. That lung really don't look so good.
A white shadow in the lower part of the left lung. It's definitely a sign of fluid accumulating in the thorax. So we know she has a lung abnormality, Rhodey. Let's narrow down the candidates.
Understood, Doctor. New symptom observed. Pleural effusion.
Well, it's shrinking up, or that's probably just all fluid down there. Yikes. Yikes-a-rooney. Let's start nailing down this bitch.
Doctor, would you like to narrow down the diagnosis candidates?
Of course. That's why I came here, right?
Alright, save again, and let's go. Okay, so bacterial pneumonia, a condition in which the lung becomes inflamed due to bacterial infection, fever, coughing. It's bloody sputum. Does purulent mean that? No. Okay. Wrong thing then. Alright. Right. Chest pain and dyspnea. Okay, so let's look here. Disease in which the lung becomes pressurized due to accumulation of air in the chest cavity. Symptoms include chest pain, dyspnea, and coughing. Respiratory... It's doing surgery with no license. Hey, here's the day. How you doing? Hope you're having a fantastic one. However, I need to make a correction. I am dangerous, especially because I don't have a license. Val pop up. Yay, Val! Carcinematus pleuritis. Got it. A condition in which the pleural membrane covering the lungs becomes inflamed. Symptoms such as chest pain, coughing, bloody sputum, and dyspnea appear. Chest pain worsens through coughing. Pleural effusion. Is this it? Escalation will confirm respiratory attenuation.
Carcinomatous pleuritis. All her symptoms.
Letting her do open heart surgery on me. You trust me so much. You're going to die.
We'll need a CT scan to confirm the diagnosis, though. Roni, how's our patient doing?
She's not doing well, Doctor. Please return to the examination.
Doctor, she's dying. She's on the floor, Doctor. Alright, let's go check on her. Doctor, I've called an ambulance. I don't think my insurance covers a virus operating on me. I mean, it's free. Your insurance doesn't cover it, but I don't charge. That's the thing. How you doing, Metataurus? I hope you're having a fantastic one. Nice, I mean, uh-oh.
my chest. It really hurts bad now, Doctor.
The computer beside me just like, Doctor, she's going to die. New symptom observed, death.
Her condition's worsened even further. We can't continue on with the diagnosis.
Get the casket ready. Like, Doctor, I've now ordered the casket. I'm now contacting her first. I'm now contacting your family. And anyone, what the hell is it called? Who's inheriting her stuff?
Roni, request a room immediately. She needs to be hospitalized and her symptoms need to be treated.
Doctor? No. I can't just let the symptoms be treated. Can you please continue examining me?
Huh? Do you know how much of a risk you're in right now?
I finally thought that I could live. I had a new kidney. I recovered from the operation. I could finally live a life on my own. So please, doctor, please find out what's wrong with me. Please cure me.
Roning, cancel that hospitalization order. Let's finish the diagnosis.
With all due respect, Dr. Cunningham.
What? You always rant about how I need approval from the patient when it comes to performing exams, but you won't listen to the patient when it comes to hospitalization and diagnosis?
Why does the doctor look like he fished his degree out of the trash bin? Because he's a trash man. That's why.
When things are inconvenient, we should push all the responsibility onto the patient? Spend all day worrying about how to avoid a lawsuit? To hell with that!
Understood. I admit even I find incongruities with the protocol that I have been designed to conform to. I think I shall add, to hell with that, into my computer registry.
He's like Dr. House, but worse. I wouldn't say that. Like, Dr. House... Dr. House, he was like on drugs and was like addicted to a lot of things and was very mean. At least Dr. Cunningham's nice and not addicted to drugs. That's how Nerve found a gun in a trash bin. Yeah. New symptom observed. Gun.
Huh. My thoughts exactly. Right. So it's X-ray time again. And order a CT scan as well.
Understood, Doctor. The CT examination is now available.
Okay, let's go. Vicodin, yeah, he was addicted to Vicodin. And generally an asshole, too.
Exam images are ready for you.
To be fair, House had a severe leg injury. He did. But he's also an asshole half the time. Dr. Cunningham, he's not an asshole, he just kind of like... he's more of an asshole to his computer than anyone else. Like, he's very cordial to all the other doctors in this game.
Put them on the display. I want to see what's going on.
Okay, new x-rays. House being an asshole is one of the best parts. That is true. Okay. Did her lung got darker? Like, her lung's darker here.
What the hell is this? Hey, Roni, this shadowing.
I anticipate this is a new symptom, as it was not confirmed by the previous X-ray.
A new symptom? Don't be ridiculous. I've never heard of anything like this suddenly popping up inside someone. Roni, collate the data and check what it is.
Yes, Doctor. One moment, please. There is no matching data. It is an unconfirmed symptom.
Unconfirmed?
Damn it. What's going on?
There is a less than 1% probability of ascertaining what it is from the data at hand. I recommend that you remember the shadowing for later and continue with the diagnosis.
Yeah, you're right. I can't spend any more time on this. Roni, let's continue with the diagnosis.
Okay, so there's a mysterious shadow that nobody's seen before. There's a CT image of the patient's lungs. Okay. Let me see. Everything looks pretty normal. Alright. I see you finally cleared out the smooth jazz for actually, like, for actual, dramatic music. Ma'am, it seems the x-rays show you have a ghost in your lungs. A little ghosty goose in there. Ma'am, I'm calling the ghost adventurers. They're gonna help identify the spirit. She's gonna die. The ghost wants a friend. That's what's happening. Okay. Like the issue is like at the left lung, so I should be looking here mostly. Lungs haunted. Lungs haunted. We don't cover that, ma'am. Ma'am, it's stage 4 ghost lung. It's too spooky. I gotta leave. Welcome to our Halloween episode of Trauma Team. Oh. Oh shit, that's not normal.
Found something. Tumor shadows.
That's the ghost, Dr. Cunningham.
Roni, make a note.
Understood, Doctor. New symptom observed. Tumor shadows on lungs.
Alright. Tumor shadows on lung. That's it. I didn't see anything else. Next thing you know, she'll have a skeleton in her and it'll be all downhill from here. On this episode of Trauma Team, we're working with the Ghost Hunters. It's a collab. It's a Jimmy Timmy Power Hour only for doctors and ghosts.
Let's get back to the office. Still, what in the world is that shadowing?
It's the ghost. Quick, doctor, we need night vision gear.
We should have all the symptoms now. Roni, I'm gonna make a call on the diagnosis.
Understood, Doctor.
Alright. Alright, so it's a tumor shadows on lungs. Alright.
There's no mistake that it's carcinomatous pleuritis, but I'm not convinced.
I need to call the ghost adventurers. They'll help me.
Skin to the small intestine. Small intestine to the lungs? How can a focus that devours the human body at such a rate exist?
Doctor.
Oh, sorry. What is it?
No further progress can be expected at this point. The diagnosis will be completed temporarily. I will leave the cause of the disease as unknown and call attention to this case.
Yeah, you've got no other choice. I'm stumped. What am I supposed to tell her?
Well done, Dr. Cunningham. Ending the diagnosis.
Alright. Finally did it. Kind of.
Doctor, are you alright? Is something wrong?
Ghost. There's a ghost here.
Please, you can say it. What's wrong with me?
I'm sorry, but I can't say anything for sure yet. Please be patient. I want to keep you hospitalized a bit.
That's fine, Doctor. I'll put myself in your hands.
I'm sorry. I promise I'll do everything in my power. Hey, Roni.
Do you need my assistance, Dr. Cunningham?
Yikes, she's in the...
Another little trick of
She's in the
yours,
fucking
huh?
cameras.
Sounds useful.
It's just what I was afraid of. It's bad.
Entire
Ghosts.
installation network.
Huh. All right.
We need to
So,
excise
what do you
your...
think about that patient?
your
I
lung.
found no reasonable matches within the current literature. I suspect it is an unidentified condition.
Oh shit, new condition.
Well, for once, I agree with you.
New condition, new
It
diseases.
mirrors Kaposi's sarcoma, but it spreads much faster.
I estimate the entire lung will be affected within 20 days.
Oh god.
We don't have time to sit and think. We need to treat the skin, lungs, and small intestine all at once.
An operation like this would yield a 10% success rate.
There's no other options, though. I'm stumped.
Should I request a hospice transfer and notify her family?
Oh, she gonna die. Like, actually.
The earth was blue, but there was no God. We did all we could. Now, we just have to hope for the best.
Doc is seriously near brain blast.
Never give up.
Never give up.
I'll be assisting. A specialist's coming in for it.
That's it! Roni, you said you have access to the full facility, right?
I did, Doctor.
We got a brain blast.
I want you to look up OLCVR data. Records, footage, surgeon name, contact info, everything. I promised I'd do everything in my power. Well, I guess I gotta follow through with that.
Alright, we got our brain blast moment. I think I know where we're going to next, which happens during the diagnosis.
Hurry.
Isn't the boy just superb? Now are you glad he's here?
Yeah, thanks to you. I'm in your debt, I guess.
Huh. You threaten me so you can use him, and then you thank me.
Hey, no threats. I just asked you to lend him to me.
Of course not. Still, I have to say, it takes guts asking for such a big favor to save your patient. Well, son, I guess you and I are square now.
To save a patient, huh? That's nothing noble like that.
Alright, so... God, it's so far in the future. Alright, but, our next one is we're gonna learn about that surgeon that was working on Dr. Cunningham's patient. Let's meet him. So, let's meet CRSO1, the convict with amnesia, who's going to perform surgery. Alright.
Get out.
Well, bye mask. Oh. Hello, pretty boy. Here he is.
This is Resurgam First Care. You'll be operating here.
You're going to be removing a ghost from someone's lungs. Frozen in time.
The only time you'll be out of cuffs is during the operation. Remember, this is 5 years off your sentence. Questions?
Yeah, 5 years after like 250.
None. I'm just here to do my business.
Hey there. Hank Freebird. I'm a doctor here. I'll be your support for this operation. What's your name?
His name doesn't matter. Let's keep the contact minimal. His prison number is CRSO1 if you need to call him anything.
Why are we letting him operate?
I see.
Why are we doing this?
I understand.
Now get started. We'll be waiting here for you.
Okay, tell me if the person dies or lives. I mean, it looked like CRSO1 was the one operating on the girl.
Well, then, I'll be explaining the gist of this operation.
Alright, so we're operating on Jacob Tillman, which is the asshole patient from Dr. Cunningham's diagnosis.
I'm told we'll be using an old CVR for a DCM case.
That's right. But, will you be alright?
What do you mean by that?
I heard from the man outside that you have no memories. This isn't just some way to pay a debt. A life's on the line.
You don't need to worry about that. Let's operate.
Okay, so he has amnesia, and he's a convict with a 250-year sentence. So let's trust him with this asshole. All right, so this is Jacob Tillman. Again, he's the patient from Dr. Cunningham's second mission. So age 55, gender male. dilated cardiomyopathy. After the incision, locate and treat quickly with an overlapping method. So we're treating on him. Let's go. His surgery, classic trauma center.
Well then, let's begin the operation.
Okay. Surgery rules: if patient vitals drop to 0, then you fail.
The patient's vitals are low. Get me a syringe.
Okay. Let's get the syringe.
Medicine is the stabilizer.
Point at the medicine, hold A, and then inject.
All right. Injecting stable. Vitals are recovered. Stabilization complete. Next, we must disinfect. Disinfection complete.
Pretty sure if the patient's vitals drop to 0, they die. Yeah, that usually happens. Unfortunate, really. Okay, let's be careful. That wasn't cool at all! That was the opposite of cool. Alright, let's look at the heart.
We need to find the affected areas.
The affected areas should have...
Alright. Oh, shit.
The yellow vial contains the antiviral drug. Alright, drug's working. Prepare the scalpel for it. Affected area has been opened.
Alright.
Now to retreat the mic first. Pull one side of the myocardium across the incision.
Okay.
Alright. One side. Alright, I'll need to suture.
Alright, let's go. Bye.
First
Yeah.
It's all going as planned.
Perfect sutures.
The test did confirm multiple affected areas, though.
Don't worry. We'll find them all and treat them.
Oh, there we go.
Alright, drug's working. Prepare this affected areas.
I'd like go the roundabout way.
Let's close the wound before it hemorrhages again. Forceps. Next. Alright.
Alright, let's...
Suturing incision.
Ba-da-ba-da-ba-ba.
That's the second.
Cool.
Your skills are amazing.
Don't waste my time with your opinions.
Oh my god.
Keep going.
Oh, yeah.
That's all. There should be more affected areas.
I'm not finding any.
Get the ultrasound out of my way. It's not helping anymore.
I had heart work done before, and if it was like this, yeah, I call my doc amazing too, yeah.
What do you mean? Tell me what you're thinking.
It's a simple fact. The ultrasound can't find everything. Let's palpate the organ directly to find them.
Alright, we're gonna slap this boy. Just give him a nice little slap. We're gonna give him a nice massage.
Inject the antiviral.
You won't find anything if you try holding your hand there for a little while longer.
Okay. Let's give it a little... Okay, that hard slap, I don't know about that. Tina, take me to dinner first. Listen. Sometimes you need to get handsy with your heart. Just like, give it a nice feely. Ah, crap. Give it a hand, you know. Oh, 69 vitals. Ah, nice, it's perfect.
I've found an abnormal area. Injecting the drug. There it is.
Alright.
Prepare a scalpel. Making an affected area has been opened. Let's close the wound before it hemorrhages again. Forceps.
Up. Up.
Next suturing incision. Suture complete.
Oh, it's only good? Okay. Alright, let's feely up again.
I found an abnormal area.
Alright.
Injecting the drug. You need
Oh.
to inject. I found an affected area. Beginning incision. Affected area has been opened.
You know, like, missing on a heart sounds like it'd be a horrible situation to have. But, you know...
Suturing incision. Suture complete. Moving on to the next area.
Anyway, let's slap him again. You know, this kind of... I'm kind of getting revenge on him, because he was such an asshole during Gabriel's, Dr. Cunningham's mission. So you know what? Like, he deserves a little slappy. He deserves me to miss a little bit. You know? Take it, call it revenge.
I've found an abnormal area. Injecting the drug.
You need to inject it into the shadow to have any effect.
Oh, let me just inject, like, the feel-good juice into this heart.
Affected area has been opened. Let's close the wound before hemorrhaging. Next, alright. Next suturing incision. That should finish the treatment procedure. Now.
Alright, let's close him up. We're done slapping his heart around. Let's go.
Beginning the incision suturing.
Okay, bop, 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 bop. Very cool.
Once we're done here, the operation will be over.
Get the antibiotic gel ready to cleanse the sutured wound. Alright, let's bandage up the incision now.
Okay, let's get the thing and let's go.
Operation complete. Let this disease pass from this world.
Impressive. I never thought I'd see surgery like that.
Operation successful. We did it. We didn't kill him. And we even got a few slaps in as revenge. Rank. Oh shit, I got an S rank, even though I kind of fucked up his heart a little bit. It's fine.
You have an amazing skill. I have to thank you for this.
Your sentiment doesn't matter. I don't need thanks.
Is that so? I think it's important to show gratitude.
Alright.
Looks like it worked. But I wonder if it's alright to use a procedure that's so outdated.
That was a fine operation, Doctor. Thank you.
Who is he anyway? Ooh, is he a famous
I
doctor?
didn't do anything worth being thanked over.
How should I know? He does have
I see.
And back to prison we go. He didn't manage to kill him. Yeah. Okay, so edgy. Look at his red eyes. So much edge in this man. I mean, I'd be edgy too if I was like serving a 200+ year sentence and I'd do surgery to get out of it. Imagine if he wasn't a surgeon. They're just like, hey, do surgery. Alright, so next one up is gonna be Hank. It's been a while since we saw Hank. He's just been kind of cameoing. Yep.
Looks like it worked. But I wonder if it's alright to use a procedure that's so outdated.
This is exactly the end of the CRSO ones.
Really something. Who is he anyway? Ooh, is
That
he
was a
famous
fine
doctor?
operation, Doctor. Thank you.
How should I know?
It's almost like we saw this before.
Skills.
I didn't do anything worth being thanked
He's
over.
got this bad boy feel to him, and that look he's pulling off. So my type.
Love in the ground. Starting off right after the surgery.
Do you like flowers?
Not really.
Aren't they beautiful, though? This one's Asclepias tuberosa.
You're trying so hard, Hank.
It's a
buddy,
perennial that
buddy.
blooms orange, red, and yellow flowers.
Is that so? Hey, aren't you gonna get mad at me?
Get mad? Why?
The sign says this area's off limits, but I'm here anyhow.
Well, I guess. But I haven't seen you do any harm, have I?
Is that how things are?
Oh, she's fucking smoking.
Don't do that.
She's smoking.
What now?
You shouldn't be so careless. The Earth's alive too, you know.
Feel free to smoke all you want, though.
So now you're gonna get mad at me.
This is different. People can't just do whatever they want. Some things are just plain wrong, and they should be corrected.
Like smoking.
Hank, what the hell are you doing? You ready for surgery?
Oh, no. I'll be right there.
Hey, Doc.
Hey, Doc, button up your
Why'd
shirt.
you become a doctor? Is it fun saving lives?
Life is wonderful, and I want to pass that on to people.
Hey, Doc. How do you do surgery with your eyes closed?
Wonderful, huh? What a weirdo.
Aw, she's smiling. Dude likes nature. I like this guy. Yeah, Hank's nice.
Hank! Rick, you have got some nerve showing up late.
Sorry. Let's get started.
Ugh. This operation deals with a pendimoma of the spine, but...
Hmm? Is there a problem?
Yeah, check it out. It's the patient's MRI.
The entire spine is swollen. It's uncommon for an ependymoma.
Right? Well, let's hope there are no complications.
Never hurts to be careful. Let's begin.
Let's hope there's no complications, she says, summoning all the complications in the earth. Alright, Daniel McCallahan. Canahan. Age 40, gender male. Extraction of spinal ependymoma. Imaging suggests it is different from the standard ependymoma. You know, if I was a doctor, half of my fucking surgery time would be me trying to pronounce all the fucking words on this chart. Because holy shit.
Let's begin. The objective of this operation is to extract ependymoma, correct?
Yeah, we'll be going through the back to get to it. Let's hurry up and
Alright,
start.
let's go. Let's bust them open. Peel it away.
First, we'll excise the vertebral arches. Bring out the laser.
Bring the laser.
Okay, keep it up. Do the same for the other side, too.
Bop. This is how spine surgery works. We just laser it out.
Not bad at all.
Easy peasy.
Excision of the vertebral arches has been completed.
Now making an incision in the dura mater. Scalp, please.
Bop.
Alright, let's proceed.
Oh, Jesus.
Alright, the spinal cord is in view now.
Humans are computers.
It is a little odd. The diagnosis results came back with ependymoma. Let's go as planned and divide the posterior median sulcus to open the spinal cord.
Hello.
That is one damn huge tumor.
I found a ruby.
At that size, it's impossible to extract all at once. Let's go bit by bit.
Hey, if you screw up here, it could seriously mess up the patient.
It'll be fine. I'm an expert at this by now. I've done like 2 surgeries.
Be careful to follow the guidelines during the incision.
I'm trying not to do too bad. Why do you have to like make the curve so big?
Good. Alright. The first stage of excision is complete. Continuing the treatment.
Alright, let's go. You know, most people would like do this in like lines. You know, like simple line. We don't have to like go on a fucking roller coaster ride. Hank.
Be careful.
Hank, it doesn't need to be like this. You don't need to make all of these little curves. Hank, please. I swear to God, Hank. Yum. Like, Hank's just like, I'm gonna make the prettiest incision ever, and I'm not gonna think about the person who's controlling the controller. He missed a spot. Like, there's a little bit here they didn't cut out. There's gonna be like a tiny nib of the tumor in there. But there's more right here. He's gonna miss some. Look at this fucking Hank. You're doing a terrible job. Okay, he's doing even worse. Like, Hank, are you really a doctor? Can you, like... Hank, I love you. You're great doctor. I really like your character arc, but, like, are you a doctor? Okay, last one. Let's go.
Not bad at all.
See, look at this shit.
All right.
My cat looks really cute right now. Okay, take a picture. Ah. Yeah, his eyes just closed. It's fine.
Was that supposed to be a compliment? I am a specialist, you know.
Shut up. Don't bother me with details. I'm still wondering about that MRI.
Hello?
Something like, huh?
Shadows?
What the?
Black bruises?
Spinal cord?
On the spinal cord?
Wait, something's wrong. Is it an outbreak of hemangioblastoma?
Spine's haunted. The ghosts are back. Spine's haunted, guys.
So this is what was on the MRI. Hey, what are we gonna do?
We gotta get the ghost adventurers.
We have to remove all of it.
Okay, let's go.
Next, continuing on and detaching the blood vessels.
That's some skills there.
Thank you, Maria, but like the ghost is the spine is very haunted by ghosts.
It's going well.
All right, it's been detached. Extract the damn.
All right, extraction complete.
If the abnormalities on the MRI are from hemangioblastoma, I doubt that's the end of it.
Looks like you're right.
All right,
Continue with the treatment.
got even more. The ghosts are relent. Why are they wiggly? They're wiggly now. Ew. The ghosts are wiggling, guys.
Rock solid.
The medical ghosts are evolving.
Alright, extraction complete. Will there be any more?
Oh. Okay, the ghosts are treated.
The black bruises disappeared?
It seems like it's over.
Medical ghosts left. Hank was too much for them.
What was that just now? I've never seen anything like it.
In any case, let's end this operation. I don't want to strain the patient.
Okay. Anyway, let's not think about that anymore.
We'll secure them with rods. First, we insert screws.
All right. Screws. Give me a second. Okay, the screws are ready to go.
Alright.
We'll insert a total of 8, 4 each on the left and right sides.
Gotcha. Aim for the guideline. Don't put them in too deep, got it?
That's the first.
Hey, perfect.
Continuing with the
Let's go. Oh,
They're incorrect.
oh, I
Continue
am
on.
a genius. Can I please screw that in some more, please?
All right, we're done.
Yeah.
Now on to the other one.
I don't think the rods are good. Oh, that was too tight.
Good. Cautiously continue on.
Perfect. Only 2 of them are fucked up. Only 2 of them will fuck this all up.
Now we pass the rod through the screws on each side.
Alright. Here we go. Pain train's incoming. Yeah.
Hand me the next rod. This one's for the other side.
And yeah.
Both rods have been inserted. Now to attach the fixator.
This treatment is rock solid.
Yeah, well done. Let's close up and finish this off.
Closing the operation field. Hand me the stapler.
Okay. Bop. 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 Bop.
Let's proceed.
Bop.
This operation's over with.
Thank you for assisting me. You were very helpful.
Did we just, like, steal his bones? We did put the bones back in. I just realized this. The bones are just gone. He stole his bones. Where'd he going? That just hit me as soon as I, like, closed that guy up. Like, we did put the bones back in. We stole them. I got an S rank, though. S rank for the money we're getting from those bones.
Man, it really does take skill to be a specialist.
It's not that special.
Your insurance doesn't cover this, I'm gonna keep what we took out. This belongs to me now. It's fine, they had ghosts. They're haunted. We gotta send it over to the ghost adventurers. They can be examined.
Yeah, well, being careful and precise really isn't how I roll, you know?
Alright.
Alright, surgery's complete.
Yay! The
It's been a while
operation
since
was
I was that
over.
nervous. At one point, I started wondering what would happen.
But I'm glad it ended well. Who knows what could have happened if Dr. Freebird wasn't here.
Yeah, you're right. You did well too, Emma. Good
He's,
job.
You all right,
he's,
big guy?
he's thinking of what to do with these
I've never
bones.
seen spinal ependymoma like this.
Don't get carried away.
Yeah, a bunch of weird shit is happening now.
Well, the surgery went great, so it's fine now, right?
Well, we can't just leave it at that. I'll report it to Gabriel.
We gotta talk about some ghosts.
Hey there, well done, everyone.
Chief? What are you doing here?
Is it that odd for me to come down here? Oh, by the way, Hank.
Hmm?
There's a lady at the entrance here to see you.
A lady?
Me?
I'm being
Wow.
serious. Now hurry up and go see.
have a girlfriend?
Wow.
Emma,
Hank.
that's the doctor's private matters. Although
This
it
is
is a
so
bit unexpected.
Scandalous.
Oh, Hank. Hank. Oh, it's your patient. Okay.
It's you. How are your wounds? You should have come inside.
I hate hospitals. They smell gross. Like medicine.
Ladies.
Oh, is that so? Well, all right. So, what brings you here?
You hungry?
What's this?
Food? I haven't cooked in a while and I made too much.
Aw.
For me? Oh, I appreciate your kindness.
The way he just fades into scene.
Leftovers. You don't need to
That's
be
the
so
magic of
excited.
Hank. That's why Hank's the
That's
best
not
boy.
true. You still took the effort to give them to me. And that alone is worth being grateful for.
You're weird.
I'm weird. Why?
My dad used to cheat on my mom. And she cried all the time. So, yeah, I don't trust men. I always end up fighting them.
Good news, lady. Hank is the best one out of this bunch.
I'm so tired of that cycle. It just keeps repeating.
Is that, well, the reason for your,
My suicide? Yeah. I mean, it would be so much easier.
That's ridiculous.
Huh?
I said that's ridiculous. Look at how blue the sky is, and how green the grass is. The world's a wonderful enough place as it is.
That doesn't make any sense. Oh well. That may be what's good about you after all.
Is that so?
I'll come again. See you, Doc.
Aw. The power stance that Hank has. It's great. Oh. Oh no. Eagle Man appears. Oh no. Eagle Man. Eagle Man appears. News of the trauma.
Hey, Hank. Huh? So you're the one who takes care of the flowers? Well, I'll be.
All right. I think the next one, let me check. Okay, so it is Sierra SO1. We're gonna go back to him. But I think Hank's story is so fun because, like, Hank, like, he has a really good story on his own, but then they just tack on the superhero aspect, and it's just like, okay. Okay. We didn't really need to do that, but okay. We can just lean into his, like, he's a war veteran. Alright, anyway, Sierra SO1, uninvited guest.
That was a fine operation, Doctor. Thank you.
Life.
Oh. They just...
Yo,
oh,
kid.
hi.
Came by to see what you're up to.
Oh, hi, Dr. Cunningham. Hi. Alright, uninvited guest. I would invite Dr. Cunningham any day.
Man, I didn't think you'd be living in a refrigerator.
Temperature's kept at 0 Celsius to reduce bacteria. And so I can't kill anyone.
What?
Bacteria cultivation, huh? Pseudomonas, Vibrio, Micrococcus? You know, plenty of bacteria can be grown at this low temperature.
And you are?
Gabriel Cunningham. I'm in charge of the guy you worked on. I want to consult with you about something.
Consult with me?
We've got a patient with tumors similar to Kaposi's sarcoma. Skin, lungs, small intestine, they must be excised at once. How about it? You think it can be done?
There's not enough information to make a conclusion. But depending on the patient, I won't rule it out entirely.
Is that so? All right, it's decided. Let's go.
What are you talking about?
The operation. You'll be performing it on that patient.
Ah,
Me?
so we're gonna try and
What's
save
wrong?
that lady's life.
That's why I came out to see you.
Alright, so CRS-01's gonna be
Please check our
operating
arterial
on that
forceps,
poor,
or I'll be at a
deathly lady with ghost lung.
We're running late. Can you check on our transfusion?
Let's see if you can excise the ghost lung.
I'm putting extra trays here. Where's the anesthesiologist?
Oh, come on in. You're late.
You are...
Maria Torres. I'll be assisting you this time. You've heard the details, right? Read the charts, too.
all right?
I have seen you before. Have we met?
I hear this is a tough condition to deal with.
Yeah, you're right. Let's start the operation.
Have we met before? I'm a horrible... I am a convict. I've done horrific things. Alright.
The focus of this operation is tumor excision, but...
Bro, she even aided in proper time for surgery. She's just assistant. She ain't doing the surgery herself. She just handed the tools over. She doesn't need a mask or anything, you know.
But...
Well, it's odd. Infections like this aren't all that rare. Even so, we can't pinpoint exactly what's causing them.
what do you mean? Have you done a blood analysis?
Please. Of course we did. Do you think we're stupid? Nothing showed up on the CRP, antibody titer, or WBC count. Other tests came up with nothing too. We're stumped.
Oh, that is indeed odd.
Well, hopefully this will be an uneventful op. Let's begin.
Alright, we are treating on the lady that we diagnosed earlier. So Shelley Brooks, age 28, female. Extract tumors from the skin, small intestine, and lungs simultaneously. Be aware of changes in the patient. Let's go. We air doctors are bold as fuck, yeah.
Well then, let's begin the operation.
Yep, and here's the spots. There are actually tumors that were on her skin. Alright.
Gabe, that is Dr. Cunningham, says it's like Kaposi's sarcoma. Who knows what it actually is, though?
The foci show discoloration, like Malignant melanoma. Let's begin by treating the skin. Prepare the laser.
Alright. Point at the area and press A.
Whoa, watch it with that thing.
First affected area removed.
Bop.
Incinerating.
Bop.
They're all burned off. There aren't any more here. Let's check the intestine.
No, we're not done yet. There may be tumors under the skin here as well. I want to check the area with the ultrasound.
Up.
Thought so. Tumor confirmed. Cytoplasm is spilling out. I'll use the drain. Now I'll excise it with a scalpel before it.
Let's go.
Tumor excision complete. I'll extract it with the forceps.
Okay, gotta put him on the tray. Bop.
Let's treat the excised area.
Then grab this. Bop.
Synthetic membrane in plate.
Looks like all the skin tumors are done. Let's keep going.
Understood. Making an incision to open the operating theater. Area disinfected. Making an incision.
Now, if it's the same as the skin, tumors should be here too.
First, we need to inject blue medicine into the
Let's fire a laser at her intestine. Or not. Let's go. Bop.
Inflammation has subsided.
Bop.
Let's treat the rest too.
There are probably more inflammations around.
I'm shifting my view. Prepare the magnification tool.
Alright. Hold B and move the pointer. Okay.
Inflammations are all over the field of operation.
Up. Need more. Pop. Pop. And, okay, so there's one here. Bop. Bop. And there's more here.
The inflammations are all treated. Let's find the tumors now.
You've got to inject it directly into the inflammation.
Okay.
I want to check the area with the ultrasound. Tumor presence confirmed. Treating
Okay.
it and inflammation.
Bop. And let's get that. Bop.
That's the first one. Keep going.
And bop. Drain it. And we'll do scalpel. And yoink.
That's number 2.
Eat.
Looks like there's another one now.
Heal. Let me get that. Bop. Sip. Snip, 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 snip. Miss the cart. And yoink.
Third tumor's been extracted. Beginning treatment of the remaining ones.
The
Okay.
small intestine has been treated. We're doing well.
Don't relax yet. We still need to treat the lungs.
I know. You're pretty blunt, aren't you?
Get ready to shift the focus of the operation.
I'm a criminal.
I've found small tumors in the lungs. Prepare the laser.
Oh shit, we're laser. Okay, ba ba. Okay. Bop, 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 bop.
There's tumors here too, right? Find them with the...
I found a tumor. Scalpel.
Bop.
It's not a tumor. Is this mucus?
Ew, ew.
This doesn't change our treatment. Let's continue. Using the drain line.
Okay. Oh, there we go. Oh, just mucus.
There have to be more of those. Use the ultrasound.
Okay. Oh, there we go.
This must be the cause of that mucus. Beginning extraction.
Bop, bop, bop. You know, I'm doing a perfect job just, you know, like, kind of swishing my knife around to get at this. Okay. not seeing anything else, but I know there's something in here. Come on. Ah, there we go.
Tumor markers aren't decreasing. Must be the mucus.
Fun fact, a normie friend bought this game because she wanted to get medical control. I mean, it's pretty accurate, right? Probably. There's ghosts in here. Anyway, how you doing, Gamma? Hope you're having a fantastic one. See, there's ghosts! No! There's ghosts! Oh god. Get the ghost adventurers. God.
Hey, what's wrong? Are you alright?
CRS1 does not like ghosts. He's very scared.
Continuing with the
Hell, is that moving?
Oh god, it's moving. Oh god. Ah! Okay, okay, alright. Blah, blah, blah. You gotta move in one here. Oh god. Oh god, it's getting worse. Yeah, blah, 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 blah. Okay, oh god. So many things are happening now. Okay, let's get the laser. Oh god. Okay. There's two tumors. Okay. Get that. No, the wrong thing. Okay. Let's get this. I got bop. Let's go. Okay. Okay, where the hell are the rest of the— oh, Jesus. Oh, God. It's getting worse. Okay. Where's that damn fourth tumor? Okay, yoink. It's mine now. Okay. Oh, there's one. There we go. Up. And let's, yoink. Up. Okay, there's still more. Okay. Up. Okay, should be nearby here. There we go. Bop. And this is a bop. Okay, I think they're activating near where the tumors are. Bop. Okay. There we go. Okay, still more. Okay. Bop. Sorry, I'm like not looking at chat right now because I'm like, everything's happening at once and it's only gonna get worse from here. There we go. Bop. Okay. They're moving. Oh, there we go. Bop. Right.
Is it over?
Yes,
There's still a ghost in here. Oh, the ghost is gone. Okay, ghost is gone. Perfect practice. This person should be dead. Listen, you just had a ghost in here.
Alright,
you know, sometimes you have a ghost inside of you.
Hey, how did you know how to treat those things?
I don't know. Black bruise. I've seen it somewhere.
He got really scared by the ghosts.
That weird before.
Let's finish the operation. Get the antibiotic gel ready.
Alright, and let's... Mission complete.
Ending operation.
Well, you know, you're a big help. Let me at least thank you.
Operation successful. We did it. And we got all cools. We're really cool. S rank. Yeah.
Huh. That was quite a show. Looks like we can trust you.
I'm just doing what I was brought here to do.
Sheesh, aren't you fun to be around? Take a compliment.
Alright, she didn't die. She lived.
Yo, how'd it go?
All the tumors have been extracted. It's a unique condition, so keep her fully monitored.
You're just leaving now? That's pretty irresponsible.
He's a criminal, Gabriel.
I'm a prisoner. I can't do anything else from here.
Well, not exactly. You're responsible for that patient until she leaves.
You want a criminal to stay here, Gabriel?
I heard that you'll be in custody here for a while.
We're just gonna keep a criminal
Let me
here.
tell you that I'm firmly against this decision.
I agree, Maria.
The new room's over there. It's barred, but it's no icebox. We'll be counting on you to help us save lives here, kid.
Alright, so we now have a pet a pet convict who knows how to do surgery good. With a 200+ life sentence.
Satisfied?
Are you kidding? I need to see how he does before I decide. Besides, his entourage is a pain in the ass, too.
What do you mean by that?
Don't treat me like an idiot, G-Man. I see a lot of new faces around here. Curious faces.
Dr. Ware.
Whoa, whoa. I try not to get involved in other people's jobs. Let's just agree not to interfere with each other. Got it?
Thanks for your cooperation.
Alright. So our next mission is actually going to be a Naomi mission, so it's going to be a longer one. So we get to see our wife again. Good day, ma'am. I'm your new primary doctor. I'm currently locked up for 200 years, but that's beside the point. Morning, ma'am. I've committed atrocities. I'm your doctor starting today.
Great. She's at it again.
Why is a child here? Dead people are here, child.
Hey, kitty girl, what are you doing? No trespassing.
Oh, miss! Chloe's better.
Aw, Chloe's better.
Chloe? Who are you talking about?
Chloe's the kitty you helped. Now she comes over to play.
Glad to hear it. In any case, you're not allowed here.
Hey, miss. What's your name?
Me? Oh, I'm Naomi. Naomi Kimishima.
Okay. Hi, Naomi. I'm Alyssa. I live just on the other side of the garden here.
I see. That makes us neighbors.
Yep, so I can come see you anytime I want.
Kid.
Now, Alyssa, this is a place where most people can't go. That's why I need you to...
Oh, and who's this little princess? Am I intruding?
Chief.
Hello, mister. I'm Alyssa.
Hello, Alyssa. I'm David.
Well, the chief likes her, so...
Can I borrow Naomi for just a moment?
Okay, Naomi's got work to do, right? I'll be going then. Bye-bye, Naomi. See you later.
This child just casually sneaking into a government facility. Wow.
It seems you've made a cute little friend.
You know she doesn't have any security clearance, right?
Now, you think I'm that uptight? It's not like we're using diamonds to decorate the garden.
Anyway, You're here to talk about work, correct? I'm listening.
Yes, a few hours ago, a body was found in Oxford.
Oh,
the
fun.
The FBI is requesting that we send you to investigate it.
Ah, fun.
Me? Is there some crime involved?
It's our job to determine that. What do you say?
This is my duty, isn't it? I'm on it. The victim lived in a cottage in Oxford with her husband. The husband called the police, saying he had killed her. When they arrived, she was on the floor with a chest wound.
I mean, it seems like a clean-cut case, huh? Well. Ah, shit, my shitty Wii speaker's gonna have to work its magic. This thing's dying. Alright, so Naomi, you need to get your phone replaced. Like, the Wiimote's dying at this.
The FBI thinks the husband may not be telling the truth. Alright. Let's discover how this tragedy played out.
Alright. Let's investigate.
Tell me the facts we have, little guy.
Yes, ma'am. The victim is 75-year-old Alma Parker. Her husband Joseph called the police late last night. On arrival, they found her body, stabbed in the chest. The husband was in a wheelchair, holding a bloody knife. Joseph's account is that they had a fight that escalated.
A man in a wheelchair stabbed someone who could walk?
That's what he says happened.
Sus.
Find out what you can about the murder. I'll check the body.
Right, please get started.
The dead tell no tales, and if they do, nobody listens. Only the dead who haven't died yet can discover the truth. Let's begin. Show me how your light was put out.
Okay, we have Alma Parker, age 75, gender female. Older woman found dead in a home in the mountains. Husband reported to the police that he was responsible, but something seems sus. Let's go. Hopefully it's not as much of a downer as the last one. Now let's begin. The victim is Alma Parker. The suspect of her murder is her husband, Joseph Parker. We have a picture of the suspect this time. I should take a look at it just in case. The white-haired man is the suspect, Joseph Parker. According to the materials at hand, it says that he's unable to walk due to a thrombi in his veins caused by APS. The victim in the picture, the woman in the picture is the victim, Alma Parker. She has beautiful white hair as well, not too surprising considering their age. However, just looking at the pictures won't get me any closer to finding the truth. The corpse should have been brought to the evidence room by now. Let's go see it. Hey! Let's look at the body. Okay, let's examine this body. Nothing on the feet. Hello?
What could this be?
Card black bruise has been obtained.
I've never seen a bruise like this. Is it something congenital? This is internal bleeding. It might have been caused by something pressing against the palm. It would require a great deal of force to leave this mark on the victim. Was she struggling against the murderer? Or is there a different reason behind it?
Okay.
This stab wound is small, but it's rather deep. There's a wound with a similar shape, but it's a different size.
Something's sussy here. Everything's always sussy with Naomi's missions. Yep, and here's the big stab wound.
This must be
I don't know if I called that small. Like, what would you call this then? 10-10? That one's small compared to this one.
It has an odd shape. The weapon's cross-section must be...
cross-shaped.
right.
I know my
The
shapes.
weapon must be shaped
Okay,
like a
clearly
cross.
stabbed then with a plug. Exactly. We solved the murder.
That weapon most likely penetrated the heart and killed the victim. What kind of weapon has a shape like that?
Hello?
The victim has a wound on her head. It's star-shaped? What can wounds tell us?
There's a star-shaped bruise on the corpse's head. This seems to indicate the victim's blood type. Oh, the bruise, the time of death. Yeah, time of death. No, wait, what?
Concentrate.
Shape. Okay, it could the shape of the weapon, but I also saw bruising like helped you determine time of death and stuff. Okay. That was we established last one. This is the last mission.
Yes. We can figure out the shape
The
of
last
the
mission
weapon
was like, oh, we can use the bruises to tell like when she died because like I don't know.
Still a star-shaped bruise. What kind of weapon?
I mean, I
would
guess we
leave
know
that?
when she dies, so I guess it's not that useful this time. Okay, so that's all. Let's look at the personal effects. Huh. Okay.
Bloodstains on the left sleeve. Was there a wound on the corpse's arm? It could be the murderer's blood. This needs to be investigated further.
Need to examine it. Okay, the small. Oh, hair.
What's this? Is it hair? That's bizarre, because...
They have white hair. Hard black hair has been obtained?
Indeed. The victim and the suspect reportedly both have white hair. I need to send this in for analysis and identification.
Okay, found everything. Yeah, there's the cross. The FBI were just like, that's not the shape of a knife. Okay. Let's look. Time to begin sorting through the information I've uncovered so far. Okay, let's look at
Hey,
this.
little guy, could you analyze this hair?
Yes, of course. Dr. Kimishima, this isn't human hair.
It's the ghost. I knew it.
It seems to be from some sort of animal. Did the victims have any tame household creatures?
He could just say pets. Little guy, you don't need to say that. He could just say pets.
You know,
like a
they're
normal
called
person.
pets.
Yeah, yeah.
And no, there weren't any signs that they had any.
Strange.
Kimishima has the right of it.
This is obviously not human hair. I can see cuticles, so this isn't synthetic hair or a fiber.
Alright. Can you identify what animal it's from?
No, that's beyond my expertise.
What are you here for, little guy?
But I do see something odd about it.
Go on.
Well, the hair has a tip, but the other end doesn't have a root.
No root. That means...
Black hair found on the personal effects has no root. That means the hair was cut.
So the hair had been cut.
Right. This means that the hair didn't fall off the animal naturally.
Why would something like this be on the corpse?
Black hair has become animal fur. Okay, let's look at this.
Dr. Kimishima, do you need an analysis?
Well, I'm not here to ask you out on a date. Just look at these.
Okay. Are these bloodstains?
Yes, they were on the victim's left sleeve.
That's odd. This blood isn't the victim's.
Oh shit. The hairs are grown from a plant?
What do you mean?
Well, the results say that only the H-type antigen was detected in this blood. That makes this blood type O.
Okay, so type O blood.
The victim has type A blood. What about her husband? He's a suspect.
He has type O. Does this mark him as the culprit after all?
Let's not start jumping to conclusions. First, let's check to see if the husband is injured. If this blood came from him, he must be wounded.
Okay. Type O blood. Okay, not that. Like
These
those
stab
two.
wounds are different sizes, but they have the same shape. We can deduce that these wounds are connected by...
The victim was stabbed twice. There are 2 murder weapons or 2 murderers. Penetrated the body.
Yes. These 2 wounds were caused by the same strike, piercing all the way through her body. If that's the case, the entry wound was...
Wounds from front or back from a single attack. Her chest?
Indeed. If something is pierced all the way through by a sharp implement, the entry wound must be at least as large as the exit wound. If these wounds were caused by the same strike, it would have to be 20 centimeters or longer. This isn't enough to identify a weapon, but it does get us one step closer.
The card murder weapon length has been obtained. Okay. Nah. Okay. I think I have to go out. Nope, actually no. I have to still sort. So... Oh, this is left sleeve, right. Okay. So that doesn't quite hit it. Is this really the murder weapon? What could have done that? We don't have any information for that. It's an odd shape. We don't have any things that we can compare it to. This is a part of the experience, but I just kind of throw everything at the wall because I'm not sure what else I need to get here, unless I have like new confession stuff. Like, I'm not sure. So I have no voice recorder. I'm pretty sure I've got everything in the evidence room. Yeah, okay. So I'm just missing something here. I haven't thrown enough things at the wall yet. Feet. Oh, hey, Matcha. How you doing? Hope you're having a fantastic one. Yes, there's feet in this game. Okay. Little guy. Little guy, you're being useless right now. I'm stuck here. Okay, let me just... Okay, I'm gonna start here. I'm just gonna work our way in, trying to combine as much as we can. Because, goddamn, I don't know what else to do right now. Stop. Anyway, there's a murder afoot. Doing good, just resting a bit now. How goes surgery? I'm not doing surgery right now, surprisingly. I just, I got S ranks on my surgery, but right now, we're in a forensics mission. So basically, we're trying to solve a murder. And I have to, like, compare all these bits of evidence together. And it's not going well right now. Because I don't know what to do. Okay, what am I missing? Because I don't have any other cards to use. I have to examine something? Little guy, can you please be useful?
Little guy.
There we go. Oh, thank. I was being stupid. Okay.
What can you tell me? How big is it?
Well, it's at least
It's over 20 centimeters. Yeah.
20 centimeters. It's shaped like a...
We're in the visual novel portion of the game. The wounds on the corpse tell us that the murder's weapon's cross-section is cross-shaped.
A cross shape. Does that help?
Yes, thank you. We'll have the results in a moment. I see. This isn't a cutting tool, like a knife.
I could have told you that, little guy.
It's like a spike or a spear. Something meant for piercing.
Ah. A husband killed his elderly wife with a spear.
So,
that's what happened.
Weapon. I don't like the looks of this.
Right. This isn't your usual murder weapon.
Hey, murder weapon length has become murder weapon shape. Okay. Cool. Oh, we got nothing else from that. So let's compare this to the weapon. Alright.
What do you think, little guy?
You mean the weapon in the shape of the wound, right?
That knife isn't long enough to have done that, and it's nowhere close to the right shape. No, something else has to be the real murder weapon. The second thing this tells us is...
Okay, the knife that the victim's husband, Joseph, claimed to use was the real murder weapon. This proves that. Just that, this proves that Joseph is definitely the killer. He's lying. Alright, got some solid evidence. The card husband's lie has been obtained.
I agree. The husband's definitely lying to us about something. In any case, we know for sure that the knife isn't the murder weapon. However, we still don't have a clue what the real weapon was, or who the killer is.
Take it easy. We just have to think about all of this. A sharp weapon, like a spear, that can go through a human body. We'll have to find out what it was.
Yeah, the card weapon inconsistency has been obtained. Okay. Yeah. How did she die? How? A spear. Yeah, get a spear. Like, the elderly couple down the street just has a spear laying around to use to murder each other.
Joseph? You mean the victim's husband who confessed to the murder?
Yes, he just keeps saying that he killed her. We've got nothing to go on.
I'd like to hear the recordings myself anyway. I want to know if the blood on the victim's sleeve was his or not.
I've already sent you the data. You can examine it whenever you want.
Yes, I'll do that. Thank you.
Joseph's account has been added to the recorder. The topic injuries has been added to Joseph's account. Well, I never partook in some casual spear combat at home. I don't know. I haven't. I guess I'm missing out on that part of life. Like, I never did a spear combat, never did jousting. Like, never done any of that. I've witnessed jousting, but I've never done it. Maybe even the witnessing part was just, you know, safe stuff. Like, not non-lethal.
I've already told you people, it was a domestic dispute. I was angry at my wife and I stabbed her. That's all there is to it.
Okay.
So what if I'm in a wheelchair? It doesn't mean I can't stab someone. She was standing right in front of me, so I just shanked her right there.
Okay.
I turned myself into the police right after. You know what happened after that. What about my
hand?
The victim's husband does have an injury.
Speaking of which, I am, like, I'm actually going to a Renfest next month, and I need to, like, make my costume. I'm actually gonna cosplay from, like, a manga for it. Because it's, like, it has a medieval kind of vibe, so that's what I'm gonna do.
Prove that the blood
just gotta fucking make it.
Husband.
I got a month, but I know I'm gonna procrastinate. That's my curse. Okay.
True. These pieces of information do share.
Fuck yeah, yeah. Hopefully, like, part of the costume has a really long, like, cloak thing, and I do have it. It's just very hot. I also need to hem it somehow. Like, when I bought it, it was, When I bought it, they only had the color I wanted in large, and large means longer. So now it's very long, and I am not that tall. So I do need to, like, bring it up a little bit.
The blood on the victim's sleeve is type O. Joseph has a wound on his right hand, and he himself has type O blood. There's little doubt that the bloodstains on the sleeve were left by him.
But, thankfully, since it'll be, like, later next month, it should be cool enough that I won't suffocate in it, which I don't like that. I don't like the heat. I already fucking almost got heat stroke during the last convention I went to because I was, like, in a fucking full suit, so I don't want to do a repeat of that this year.
That doesn't prove that he killed Alma, though. We'll need more evidence to be certain. Let's keep investigating.
Okay, so is Joseph's bloodstain here? I don't have anything else to go on right now.
This is one bizarre case. There's so much about it that's hard to believe.
You don't think the husband did it, Dr. Kimishima?
Who knows? Anyway, let's put the facts we know so far in order. The reason why it's doubtful that the victim's husband is the murderer is because,
his hand's injured. He can't stab anyone. Oh. Never mind. He hid the real murder weapon.
Yes. The knife he says he used could not have caused the wounds she died of. There are other reasons to doubt him too, no matter what weapon he used. Pushing it all the way through a human body would require a lot of strength. But he's...
He can't stand.
Indeed. He is wheelchair-bound and cannot stand under his own strength. Would he be able to kill someone like this while sitting in a wheelchair?
His hospital records make it clear that he can't stand up at all.
Yes. The shape of the weapon and the details of the death make it unlikely that he's the murderer. Still, he insists that he's the one who killed her.
I don't get it. Usually people lie to avoid being blamed for a crime.
Or people lie to protect someone else.
Huh.
You ever think of that, little guy?
Experience with lying, Mr. Investigator?
Hey, we agreed not to bring up the past, didn't we?
But why would he want to make himself the criminal?
All I can think of is that he's defending somebody else.
Ah, there we go, little guy.
Either that, or covering up an even bigger lie. That doesn't change what I need to do at all. Contact HQ about the inconsistencies we've discovered and interrogate the husband again. I'm going to the crime scene. Tell them that, too.
Understood. I'll get authorization immediately.
The Sea Mountain House can now be investigated. Alright, let's go. This is the crime scene. Let's begin the investigation. Oh, this time they have a little outline. That's cute. They didn't have that before. Alright. Alma Parker was found dead here. Okay. Cool. What's this?
It's a shard of glass. What could that be from? Supposedly, only Joseph and the responding police officer were at the murder scene. If that's the case, then...
The shard of glass was found at the scene as a piece of something. What that's odd about is that there are no other pieces around? It could hurt if you step on it. That too. The glass shard has been obtained.
Yes, there were no other shards of glass in the area. The police wouldn't be so foolish as to contaminate the crime scene. I'm beginning to wonder if someone there had cleaned up the other shards of glass. I could send this shard to analysis. We might learn something about it.
Okay.
There are traces of
something's
having
been
been
burned
in this fireplace. It's something other than firewood. I wonder if there's anything left. Huh, I've got something. What is this?
Card Mysterious Ashes has been obtained.
There's something else here, too. Is this fur?
Oh hey, that's like the fur that's on her body. The card Burned Hair has been obtained. Okay, so I need to probably spray some stuff. Alright, let's see. Nothing. spot. Nope. Okay, there's probably gonna be something around here. With blood on it. Nope. Alright. Nothing. Alright. Still haven't found everything here. Phone. Nothing in the trash. Photos. To look around here. Nothing. Get the powder. I always get stuck on these ones. Because you're not sure where exactly you need the spray. Or do the powder on. But I know I'm still missing something because usually I'm prompted. Or it doesn't have clicked everywhere. Oh, okay. I see the click on the clock.
There's an inscription on this clock. To my loving father and mother from Abby. A gift from a family member? Why does this decoration look familiar?
Oh. That's for the bruises on her head. Bruises on the corpse's head. The card clock has been obtained.
That's right. It's the same as that star-shaped bruise on the victim's head. The murderer could have struck the victim with this clock. I need to take this back and carefully investigate it.
Mine now. That should drop things up here. Let's go. Actually, okay. I was thinking like maybe they have like a cross-shaped fire poker or something. I don't know. Let's do a save because I've already lost a heart. Let's sort through.
Huh. The decoration on the clock matches the victim's head wound, but this couldn't possibly have been the fatal blow. I need to know exactly how this wound would have affected her.
The card clock murder weapon (?) has been obtained. And then we got the burned hair.
These two hairs appear to be the same.
The card Mysterious Fur has been obtained.
If that's the case, then the hair from the fur was on the victim's clothing. Why, though?
Okay, let's get the ashes. Okay. What was it from? We don't have that answer right now.
Hey, little guy. Your turn.
Yes, what is it? Oh, you need something analyzed? Just one moment. There's some kind of compound on the concave surface here.
Any details?
It's wine.
Oh, from a wine glass. Okay.
So, there's wine on the inside of this piece of curved glass. That means this shard comes from...
guys. It comes from a chandelier! That's why it has wine in it. Wine glass.
That's probably right. Then again, there could be some oddballs who drink wine straight from the bottle or something.
Perhaps. Let's assume for the moment that it's from a wine glass. A little more investigation may provide us with more information.
Glass shard has become broken wine glass. Okay. Okay. It looks like we're kind of at an impasse here. Yes, the wine chandelier. Exactly. Wine chandelier. Yeah, don't... Okay, so we're still waiting on the next confession. Not the next interrogation. Okay, Wait. Nah. Nah, it can't be. I was thinking, like, maybe the top of the wine glass? No, that's like, it's kind of like a bean shape here. Unless I have a bean-shaped wine glass, which we don't know yet. Oh, okay, so we just need to have it analyzed even more. Okay, so that's off the table right now. Cool. Okay, game, can you please throw me a bone? Okay, still analyzing the wine glass. Okay.
Little guy, could I bother
there
you
we go.
for a moment?
Anytime. How can I help?
Well, the wound on the victim's head was caused by a clock found at the scene. I want to know what that wound would have done to the victim.
Okay, I get it. I'll start looking into it right away.
Let me know the moment you get some results.
Okay, okay, so, two things being analyzed. Thank God. Alright, let's go.
Kikushima, I need to tell you something.
Is it good news?
No, bad. Another corpse has been found.
Another one?
Give me a break. I'm already in the middle of investigating a case for you.
Well, the thing is, it might be related to the Alma Parker case.
What do you mean?
A female corpse was discovered in a warehouse at the harbor. The victim is identified as Abigail Parker.
Uh-huh.
She's Alma Parker's daughter.
What?
Yes, it's not just Alma now. Her daughter's been murdered as well.
My God. Is there any connection between the two cases?
Probably.
We don't know yet, but considering the timing, I believe there's a good chance that they're related.
Uh-oh.
All right. Send the corpse over here. I'll perform an autopsy.
Right. I was going to come over and tell you about the clock anyway. I'll load all the information that we've confirmed onto the computer, too.
Huh. A man who comes to visit bringing a dead body as a present. You're the worst guest ever. This kind of thing tends to upset people, you know.
Hey, come on. This is my job.
I'm joking. I'll have a room ready.
Ah, romance. Bringing corpses to each other's houses.
Yes, that
you
would
know,
be helpful.
for autopsies. You can now switch between corpses to examine in the evidence room. The card 2-day-old corpse has been obtained. Hey, let's go.
The daughter of Alma Parker, the first victim, Abigail Parker.
Oh shit, we got her. Alright, let me get this Wiimote action in. Okay. Alright, that was a little more legible, actually. Like, I actually could understand that from the Wiimote. The card Deceased Voice Abigail has been obtained.
These were her last words. I'm not making any promises, but I've heard your words.
Okay. So we're on Abigail Parker. Let's look at this corpse. Welp. Hi.
This is a cut. It seems like it was inflicted intentionally.
Yikes-a-rooney.
I feel like I've seen a similar wound somewhere before.
Oh yeah, that's the same wound as on Alma. Interesting. Okay, oh, same...
There's a deep wound
same wound, too.
This must be the fatal wound.
I think they're connected.
Hmm? This stab wound has an odd shape. I've seen this somewhere before.
Okay, that's all we can examine, because there's nothing else on her. Let's look at her stuff. Okay, so she has a calculator.
Oh, this is the cell phone.
A cell phone.
It won't turn on. Is it broken?
The card Abigail's phone has been obtained.
This should be sent in for analysis. It may have some useful information.
Okay. Oh, wait.
Abigail's hair isn't black. I've seen this black hair before.
It's on Alma's clothes. Yeah, they're connected.
That's right. It was animal fur.
Okay, it seems to be everything, because that's a weapon thing. Pretty dress, though. I like the dress. Good fashion sense from Abigail. Okay, let's go to the office. Let's do another save. Let's keep going. Okay, familiar hair.
Just as I thought, these two hairs are identical. So we know that the hair from the fur found in the fireplace at the murder scene was on both of the two victims. From this, we can deduce that
they were wearing fur coats. The animals in the evidence room. They're killed by a monster. Bigfoot's here. Killer wore the fur.
Indeed, the murderer had been wearing or using the fur somehow. Thus, it's not surprising if we found evidence of it with both the victims.
Okay, got the wound of the right palm matches black bruise.
These murders are too similar for us to dismiss the possibility that they're related. The wound on Alma's hand wasn't caused by external trauma, while Abigail's wound was obviously made using a sharp tool. At first glance, these may seem to be completely unrelated. However, if we consider any similarities or connections between the two corpses, these wounds may indicate some hidden link that we haven't discovered yet.
The card wound and bruise has been obtained. Okay. Okay, you can't do that. Oh, do you need something analyzed? This is Abigail's cell phone. Yes, can you see if it can be repaired? We might be able to learn something from it. Gotcha, I get on that. Okay. Let me compare this. What? Okay, never mind.
Little guy, can we tell anything from this wound?
One moment. Let's see. The stab wound in her chest is the same shape as Alma's stab wounds.
Is that so? My hunch was right. This proves...
The murder weapon was the same? Yeah.
Yes.
Biggest brain ever. Wrinkles everywhere in my brain.
So were they murdered by the same person?
It's likely, but there's no conclusive evidence of that just yet. The wounds aren't exactly the same. There's something very different about them.
Huh? Where?
There's a difference between Alma's and Abigail's stab wounds, though. The difference is depth of the wound.
Yes. The depths aren't the same.
One goes right through and the other doesn't.
Couldn't that just be coincidence? They weren't killed by a machine after all.
I can't rule that out as a possibility either. Still, Alma's stab wound pierces all the way through her body and out her back. Abigail's wound barely reaches her heart. These wounds would require a vast difference in strength to inflict.
I see. Is that so?
In any case, it's dangerous to make more assumptions than is absolutely necessary. Let's continue investigating.
Abigail's wound has become same murder weapon. Okay. Same murder weapon. You can put it with the inconsistency? No, I can't. Okay, I still need to work through this. Okay, nothing. Can I give this to you? Nah. Okay. We don't have this yet. We don't have this yet because we don't know the paper. Wait, can I go to the warehouse yet? Okay.
Indeed, these facts can be put together. Alma and her daughter Abigail. The two corpses share one common thing. That is...
The two victims' corpses had the same... What the two victims' corpses had the same... Why am I adding same in the sentence? Had in common was... the weapon that killed them.
Yes. The same weapon was used for both murders. Another similarity can be found among their belongings as well. That is...
What the two victims' personal effects had in common was... black animal hair. The card's same killer has been obtained.
Yes. Both of them had the same type of animal fur on them. There's a very high possibility that these crimes were committed by the same person.
Okay. Same person. Okay, so if we had more evidence... Okay, Dr. Kimishima, I can't analyze this as it is right now. If there's some change in the evidence, I might be able to review it. Okay. There you go.
Dr. Kimishima, a new testimony has arrived.
Good. Whose testimony is it this time?
Let's see. First, we have the person who found Abigail's corpse. He owns a restaurant, but he seems to be an acquaintance of the victim.
Really? How did they know each other?
Well, it seems the victim was an occasional customer at the restaurant. According to the testimony, the victim had visited the restaurant not long ago.
I see. This may be able to help us determine the victim's situation before she was killed. We should confirm when he last saw the victim as well.
Cook's account has been added to the recorder. The topic, when did you last see her, has been added to the recorder.
Yes. There's another bit of testimony that needs to be addressed.
Go on.
Well, it's Joseph Parker. He's begun confessing to his daughter's murder as well.
God damn it, Joseph.
What?
You didn't do it.
When the questioner asked him about Abigail's corpse, he started with the whole I did it spiel again.
Why did you fools tell him about Abigail?
Well, he is her father after all. Someone was bound to tell him.
Well, we've lost the chance to learn what really happened from him.
No matter where you go, there's always somebody who has to ruin it for everyone.
Oh well, what's done is done. I'll listen to his testimony too. Send the voice data over.
Understood. Please do so.
New details in Joseph's account has been updated. Yay! Okay, let's listen to these guys. Alright, listen to recording.
What? Abigail was...
Wait.
What?
So he didn't know about it initially.
True. I mean,
Yeah, he definitely did not do it.
I mean, yeah, I killed my daughter Abigail too. I'm admitting it. I did it. What more is there to investigate? Who cares about the weapons? It doesn't matter. Quit fooling around and give me the death penalty.
Okay. Obviously, he's being sus right now. Victor Pedrini, age 40, gender male. Summary, discovered Abigail's body. He was questioned about what he saw.
Well, when I found the body, I was up that morning fishing for the restaurant's chef's catch special.
Huh?
Oh, yeah, if you go out a bit there, they're quite easy to catch. The market's fish aren't good enough. No, for the fish to be at their freshest, they have to be killed right when they're caught.
Fish.
I was shocked. I never imagined I'd pull up a corpse. And even worse, it was Miss Abby Parker. That's right. I've known the Parkers for years. She'd come to the restaurant with her parents every now and again. Heavens, no. They never fought. They seemed very happy. A wonderful family. The last time Miss Abby came was...
3 days ago.
He says that Abigail was at his restaurant 3 days ago.
The card Abigail's Trail has been obtained.
So Abigail was still alive at that time.
Okay. Abigail's last seen 3 days. How long ago did she die?
We can trace Abigail's whereabouts with these facts. Her corpse was found about 2 days since her death. The man who found her body last saw her 3 days ago. That means that when the chef saw her...
When Abigail was last seen 3 days ago, she was dead 2 days before the body was found. That means she was seen after she died. A ghost! Oh, I got a sleepy little boy. Sleepy little Lawrence. Hi, Bubby. He's been all sleepy. Aw. Little baby. Hot days. She had been poisoned. I'm gonna say hours. Yeah, hours. The card Abigail's time of death has been obtained.
Yes. It was not long before she was killed. There's a high possibility that Abigail was killed soon after she left his restaurant. It would be best to investigate the man who was seen with her the night she died.
Okay.
Oh, Dr. Kimishima, could I bother you for a moment?
If I said no, would you leave me alone?
No. I definitely think you should hear this.
All right, hurry up.
Thank you. Well, HQ has made a move.
Oh?
The FBI has arrested a suspect for Abigail's murder.
What's going on?
Who knows? Maybe they're jumping the gun. I don't know what the higher-ups are thinking. The man's name is Sean Bowen. He was Abigail's boss where she worked. His wife, Carolyn Bowen, was also taken in for interrogation. They're both at HQ now.
Huh. Is there any evidence that he's the killer?
It seems that this was found at the scene where Abigail had been murdered.
What's this?
It's an expensive lighter made in France. It's a custom order with his name engraved on it.
Sean Bowen. Well, there's no mistaking that.
The card custom lighter has been obtained.
We also showed Sean's picture to that chef. He confirmed that Sean was the man with Abigail at the restaurant the night she died.
I see. Let me guess. Here's what the FBI thinks happened. Abigail was having an affair with her boss. The situation got complicated, so he killed her.
Bingo, Dr. Kimishima. That's exactly what HQ thinks happened.
Yeah, and that's not what happened, because it's not simple like that in video games.
What about Alma's murder, then? Would he take the trouble to murder the girl's mother to hide his affair?
Honestly, I don't think they're looking that far ahead. They'd rather believe this than think that Joseph committed either of the murders.
I see. So Joseph is defending the man who killed his own daughter?
Well, now that you mention it, that doesn't make sense at all.
Alright. We can't say for certain that this man, Bowen, isn't the murderer just yet. I'm sure he'll be able to tell us what Abigail was doing on that night as well. Can you get the interrogation recordings, little guy?
I've already got them. I know my stuff.
Nice of you to stay on top of things. Send me that data ASAP.
Got it. I'll do that now.
Boss's account has been added to the recorder. Alright, Sean Bowen, age 44, gender male. Abigail's boss. He was asked about his relationship with her and his whereabouts the day she was killed. Let's just listen to it.
Good heavens. What's going on? I haven't done anything to get interrogated by people like you. Abby? Yes, she did work for us. She was a very innocent and beautiful girl. You know the type, right? Look, I'm sure you figured it out for yourself, right? What we have is a relationship
Oh my god.
between two consenting adults. She's the one who asked me to meet her at the restaurant, but she got a phone call and left before the meal came. She went. How should I know? She said something came up, but who knows? Huh? That's my lighter. Where did you... The scene of the murder? A warehouse at the harbor? No! I've never been there. I don't even carry that lighter with me. I keep it at home, so what would it be doing there? I get it. This is a trap. Someone's setting me up to be the killer. Listen, that lighter's a custom-made, expensive piece. I keep it carefully locked in a showcase at home. The showcase? It's in my living room at my house. The only keys to the case belong to me and... me and... Oh, don't tell me.
Huh. Why did his testimony end there?
Oh, that's when his lawyer arrived.
And they took measures so he wouldn't say anything self-incriminating, I take it. That's alright, though. I learned something important that I hadn't been expecting.
Huh. You got some useful information from that recording?
You weren't paying attention. If that man is telling the truth, then Abigail's cell phone has an important clue. That is...
According to Sean's account, the victim's cell phone may have important information, that is, records of calls received. Yeah, she got a cell phone call.
Upon receiving a call from someone, she abruptly left the restaurant and was killed. It's quite possible that call came from the murderer.
I see.
Even if the caller isn't the killer, we can identify who called her.
Gotcha. I'll make sure they hurry up and analyze the cell phone.
Wait. We also need evidence to back his testimony up as well.
That's true. What can we do about that?
It shouldn't be difficult to get a witness to verify his testimony.
A witness? But who?
Think about it. It would have to be.
Person who can ask to order Sean's testimony is the chef. The victim. They're dead.
Right. He did remember seeing Sean and Abigail at the restaurant that night. You think he might have more to say about how they were acting then?
Yes. Can you go talk to that chef one more time?
No problem. I'll ask him for more details about that night.
There's also that lighter to consider. It's most likely that it was removed from Bowen's house by...
The only person who could have taken Sean's letter from his home is... his wife, Carolyn, probably?
Yes. According to his statement, the lighter was supposed to be in his home. The only person besides him who would have been in a position to take it would be his wife, Carolyn. If we inspect the lighter itself, we may learn something from it.
I see. You'll need the recordings from Carolyn's questioning as well.
Why would you make a lighter and just have it in a store case somewhere? Like, that's a question for me. Like, it has nothing to do with the case, but like, why?
I'll send it over right now, so please use the recorder to listen to it.
Yes, make sure I get those. I'm counting on you, little guy.
Moss's wife's account has been added to the recorder. Carolyn Bowen, age 35, gender female. Oh my god!
Your PC is absolutely fine.
Ah, Panda Attack. Hi, Rize. Thank you so much for the raid. How was your stream? Let me give you a quick shout out. Everyone check out Rize. Where are you streaming? You're streaming Hollow Cure. Oh, a lot of people are playing that game. Hope you had a great time doing it, playing Hollow Cure. Yeah, didn't it have an update? I don't play Hollow Cure, but I've been hearing a lot about it recently. Yeah, it does. Yeah! Panda Attack. So welcome in, everyone, from Rize's stream. My name is Neurosis. I am a computer virus PNG tuber, and we're currently playing Trauma Team, which is a medical drama BN kind of thing. Charlotte's Constellation, thank you so much for the follow. I really appreciate it. But right now we're investigating a murder. We're doing a forensics case right now. And we're trying to investigate the truth of how someone died, how two people died. We actually found two corpses. So that's what we're doing right now. We're listening to testimonies, we're gathering evidence. But yeah. Investigation arc, yeah! We're here with our, the best girl in the game, Dr. Kimishima. Yeah, so right now we're just listening to recordings from testimonies about the murder case. So let's sit back.
What's this all about? Why are you keeping me here? What could I possibly have to do with you? Huh? I was home all day on that day. So what? You found his lighter at the murder scene? Is that so?
Huh, that's a little sussy.
Why? So, is he a suspect now? I don't know anything about it. I don't give a rat's ass about that cheating bastard. Can I just go home now? I don't want to deal with a murder investigation.
She's rather emotional. Is she unstable?
That's just normal, Dr. Kimishima.
Oh my god.
You're a little too calm.
Well, I have my moments too. Sometimes.
Anyway, Carolyn's insisting that she was home the entire time.
Is there any way to prove that?
No, there aren't any witnesses. She says she was alone the entire time.
Did she know that Sean and Abigail were together that night?
No, we told her that her husband is a suspect in a murder investigation. She shouldn't know that Sean was involved with Abigail. We're trying to keep the details under wraps.
I see.
Well, she knows that he was cheating.
Then she knows too much.
Huh? What do you mean?
Let's listen to her testimony one more time. Pay attention.
The topic peculiar statement has been added to the boss's wife's account. Alright, so we now have to listen to the testimony again and, like, look for this key evidence. We need to look for the peculiar statement. There's probably that he mentioned.
What's this all about?
Okay.
You found,
Okay.
I don't give a rat.
Oh, there it is.
I don't give a...
That bit
Yep.
at the end. Why did she call him a cheating bastard?
Because she knew.
Maybe he's cheated on her before. He looks like a player. I mean...
That could be a possibility. But what if there was another reason?
Like what?
Well, for example...
The probable reason why Sean's wife Carolyn called him a cheating bastard is that she, saw him with Abigail? Yeah. The card, The Woman Who Knew Too Much, has been obtained.
Yes. What if she had seen Sean and Abigail together?
That would explain her hostility.
If that's the case, then she did witness what happened to the victim that night. This might lead us to something even more important.
Okay. Let's sort through this shit.
Hey, little guy, I need something analyzed.
Sure. Is it the lighter that was found at the murder scene?
Yes, I just need you to find any fingerprints on it.
Fingerprints? Just a second. There seem to be a lot of them. Oh, wait. They're all the same set of prints, repeated over and over.
Can we find out whose they are?
Let's see. These are Carolyn Bowen's.
Bingo. So the one who left this lighter at the scene was
Carolyn Bowen.
Right. Sean's wife, Carolyn, left the lighter at the murder scene.
Custom lighter has become only fingerprints. Okay.
Carolyn Bowen, Sean's wife, left the lighter at the scene of Abigail's killing. Her interrogation suggests that she saw her husband together with the victim. Does this mean that Carolyn is behind both the murders in this investigation?
Carolyn's the culprit. We really can't say for sure. There's so much to go through.
Even if she had a reason for killing Abigail, she had no motive for Alma's murder. But she may be able to provide us with information regarding Abigail's murder. I need a little more information from her. That's the little guy's job.
Card suspect Carolyn Bowen has been obtained.
Oh, Dr. Kimishima, what's this?
It wasn't Sean who left the lighter at Abigail's murder scene. It was Carolyn. That makes her our most probable suspect now.
Really? I wonder what HQ's going to think when they hear this.
I don't care. I'm not interested in your office politics.
I know that. So, what do you think? Honestly.
I find it most likely that she's not the killer. Still, she may have witnessed something. If she finds herself our main suspect, perhaps that will loosen her tongue a bit.
I see. I'll use this info when I speak to her then.
You're going to talk to her yourself? That's odd.
It takes a liar to catch a liar. I'm good at this kind of thing.
We've all got secrets, don't we? I'll be counting on you.
Right. Oh, by the way, Abigail's cell phone has been repaired.
Great. Were the records of received calls intact?
She did receive a call during the time we believe she was at the restaurant. However, we've traced the call to a nearby payphone.
Uh-oh. Uh-oh.
Huh, I see. I wonder if this information will lead us anywhere.
We're going to ask around the area if there were any witnesses near the phone, but we don't expect much. Still, there's no doubt that that was the last call made to her cell phone.
I see. So there's a good chance that call came from the murderer after all. Abigail was called out from a public phone. And then she was killed.
We'll continue looking into the deal with the payphone. Oh, we spoke to the chef again, too. Check out the recorder when you have time.
All right, I'll listen to it later.
Analysis complete. Abigail's phone has become payphone call. New details have been added to the cook's account on the recorder. Okay. Let's listen to that. Alright.
How'd she act? Let me think. I remember that she was talking on her phone. I clearly remember that she left the restaurant in a hurry soon after that. The man who was with her left in a bad mood afterwards. No, I don't think that he went after Miss Abby. No. He left the restaurant an hour after Miss Abby did. I know that because I served a carafe of wine to the table. The gentleman drank it all himself before he left. I remember being disappointed because they ordered a very fine wine.
Dr. Kimishima, we've received a recording.
More questioning? Who is it this time?
Carolyn Bowen, Sean's wife. Once they confronted her about the lighter, she started talking.
I see. I'll check it out.
Okay, let's listen to updated testimony.
So what if my fingerprints were on the lighter? That's got nothing to do with... Huh? Why am I a suspect? No, I'm telling you it wasn't like that. That skank. I didn't report it because I knew I'd get dragged into this mess. Yes, that's right. I happened to be out that day and saw them dining together. They looked like they were having the time of their lives, and I lost it. I was going to charge in there and slap both of them, and then the skank left the restaurant still on her phone. I followed that slut, but just because I was curious. I didn't want her to get away. Of course I was angry. She went into a warehouse not far from there. I couldn't see too well from where I was hiding, but she didn't come out for a while, so I peeked into the warehouse, and there was this hairy beast. It was on top of her. It was doing something to her hand with its terrible claws. I knew she'd been killed, but I had nothing to do with it. I mean, it serves her right. Did she think she could just steal any man she wanted? That's probably when I dropped the lighter. Of course, I didn't report it. I would have been the very first suspect.
Alright guys, it is Bigfoot.
I don't believe it. This is one weird testimony.
The werewolves strike again. Yeah, it's Bigfoot after all. It's either Bigfoot or werewolves. Take your pick, guys.
Our murder investigation suddenly turned into a monster hunt. We've had a sketch artist create a picture from her account, but are there any animals that size around here?
Oh god, it's a creature from Hollow Knight. It has the little mask and everything.
Don't be ridiculous. It's someone wearing a mask and some kind of costume.
I can't believe that Hollow Knight stole from Atlas's hit game Trauma Team from 2012, where Bigfoot. Yeah.
I thought as much. Could the killer be insane?
Who can say? There's no way to know anything yet.
The card Crazy Monster has been obtained. Oh god. Alright, let's look into the Crazy Monster. Oh wait, the fur. The fur. Oh, the fur is still being analyzed? Okay. Wound and bruise. I mean, that's fur. So it was like carving something into her hand. The murderer Carolyn saw seemed to be wearing some kind of costume. There is something else.
From this now I know what that white shard from the fireplace was. It must have been from the mask that the murderer was wearing while committing the crimes.
Oh, so we know what the mask looks like now. Solid evidence. The card masked subject has been obtained. Suspect has been obtained.
Why would the murderer throw the mask into the fireplace? Whatever the reason, it helps to sort everything out.
Okay, so we have some solid evidence.
Okay, I need to sort out the information I have on hand. My main concern right now is the costume worn by whoever killed the two women. How did it end up in the fireplace in the Parker residence, where Alma was murdered? The most logical reason that can be considered at the moment is...
The reason the costume the killer was wearing when he was destroyed in Parker's home was to destroy the evidence?
Yes. Putting it in the fireplace could be an attempt to destroy it. And if that is the case, something strikes me as odd about how Joseph, Alma's husband, was acting. That is...
If Joseph is the killer, then he did something that conflicts with the destruction of evidence. That is, he confessed to the murders, because if he was hiding... He's trying to hide the evidence then.
Yes. He confessed to Alma's murder from the very beginning. If he was willing to confess, what reason would he have to hide any evidence? Let's assume for a moment that someone else is the real killer. Can we follow this hypothetical person's steps? This person would have killed both Alma and Abigail. The first person to be killed would have been...
Abigail. They both aren't dead.
Right. Alma's corpse was found first, but Abigail had been killed before then. In other words, the killer wore a costume to kill Abigail, then killed Alma the next day, after which the costume was discarded into the fireplace. However, we haven't found the murder weapon yet. There were no traces of it in the fireplace. The killer would also have some connection to the two victims as well. We can assume that Abigail personally knew her murderer. The reason for this is...
The reason why it appears Abigail knew her killer was that she responded to the phone call.
Right. She received a phone call from a payphone to call her out. The killer knew Abigail's phone number, and Abigail rushed out right after receiving the call. It's unreasonable to think that she would do that for someone she didn't know. Similarly, there's a good chance that Joseph knows the killer as well. This is because...
It's likely that Alma's husband Joseph knows who the killer is. The reason for that is... he's lying to protect him.
Yes. If that wasn't so, Joseph would have no reason to defend whoever killed his wife. So, is the killer someone that the entire Parker family would be acquainted with?
Oh, hello.
Dr. Kimishima, sorry to keep you waiting. We've taken a look at the clock we recovered from the Parker house and...
Oh, hello? Naomi, can you hear me?
Oh my god, the child has infiltrated the FBI.
Alyssa? What are you doing there?
Wow, I can hear you. This guy let me in.
Infiltrated.
Little guy?
This girl said that she really had to talk to you.
Alright. Alyssa, can you hear me?
Yep, I can hear you.
I need to do some work with the man you're with. Be a good girl and be quiet for a little bit.
Okay.
Okay. So, about that clock.
Yes, I heard that much. Get to it.
As you mentioned, the decoration on the clock matches the wound on the corpse's head. It probably fell off the desk and struck the victim's head. This may have happened while she was struggling with her assailant.
I see. Is it possible for that wound to have been the cause of death?
No, that's impossible. The impact wouldn't have been enough to kill someone. We've inspected the exterior of the clock, but it doesn't seem that damaged either.
I see. Then... Little guy? What's that sound?
Sorry. Looks like this clock is the kind that plays a little tune.
I hope you have a good rest of your night. I'm gonna go lay down and sleep. Yeah, thank you again for the raid, Rize. And please, hope you have a great rest of your night, a good sleep, and a good morning when you wake up. See ya.
Hey, Naomi?
Alyssa, you said that you'd keep quiet.
I'm sorry, but that clock is broken.
Broken? Where?
I mean, I know how this song goes, but this one part sounds all weird.
Huh? Little guy, has anybody looked inside the clock?
1 second. What the? Dr. Kimishima, there's something inside.
Oh
We may have
shit.
found just what we're looking for. Thank you, Alyssa.
Well, we found the weapon. Murder weapon has become sharp steak. Alright. Actually... let's get this analyzed.
I want to know more about this weapon, little guy.
Oh yeah, no problem. It has an X-shaped cross.
Thank you, child FBI spy. She's doing such a great job. Oh shit. So that matches the bean shape on Alma's hand. Uh-oh.
It's thinner at the tip, and it's shaped more like a steak than a knife. This isn't a commercially available weapon. This is just a piece of steel with sharpened edges.
Huh. So the killer made it?
It seems that way. It's a poor cutting implement, but it could certainly be used for stabbing.
I see. This could be the weapon then.
Analysis complete. Sharp stake has become weapon blade. I think know where this is headed. Okay, hilt.
The shape on the end of the weapon's hilt appears to match the bruise on Alma's hand. This bruise could be from Alma pushing her hand against the hilt of the weapon. If that's the case,
So
then the
Alma
person
killed
who used
Abigail to
this
get
weapon
yeeted
would
into
have
the
to be-
afterlife herself. It's looking that way. The bruise on Alma's left hand palm matches the shape of the murder weapon's hilt. That means Alma used the murder weapon. The card Alma's weapon has been obtained.
Yes. If the weapon is used by thrusting forward while applying pressure with the palm, then the only way Alma could get this bruise is if she was the one wielding the weapon. But what does this mean?
Oh, our cat's being really cute right now. Aw. Okay, weapon blade. Okay. Okay, so I still need to work on this. Okay.
These two pieces of
There we go.
information can fill in Abigail's timeline that night until her death. When was she last seen before she died?
How many days ago was the murder victim Abigail Parker last seen? 3 days ago.
That's right. She was seen at a restaurant that she was a frequent customer at. The one with her at the time was...
Sean Bowen. Naomi Kimishima. I went to dinner with her.
Afterwards, she left the restaurant alone. The reason she left was...
While Abigail was at the restaurant with Sean, she left by herself. It was because... she had a phone call.
Yes. A phone call caused her to leave the restaurant immediately.
Hello? Can I have some chicken McNuggets too? Yeah? I got 10 chicken McNuggets meal. Huh?
Yes, I like 30 chicken McNuggets.
Hey, Bubby.
What kind of sauce do you want?
Honey mustard?
And do you want it as a whole meal?
Yes, please. Medium. Yeah. Yeah, fuck yeah, chicken nuggies. Hi, Bubby. Yeah, he left. Chicken. Oh, Bubby. My fucking cat. Like, for some reason, only when I'm holding him, he like, you know how usually when you're like about to set down cats and they just kind of jump out of your hands, like, oh yeah, I know how to do this, or you can just like drop them and they just land. If I'm holding my cat, he just expects me to just gently put him on the ground, because I think that's what I do. So, like, I just, like, handled him like a normal-ass cat, like, oh, there you go, Bubby, and they just, like, fucking stumbled. Oh my god. Bubby. Sometimes you gotta act like a cat, dude.
But where did this call come from?
Payphone nearby.
Indeed, the payphone near the murder scene. It's most likely that the killer called her from the public phone, then waited for the victim to arrive and ambushed her. That would be what happened on Abigail's last night in this world.
The card Abigail's last night has been obtained. Alright. Ah, still need to work on these. Okay. Okay, so I still need to look at the real weapon shape. Okay.
Yes, if we put these together, it should be easier to identify the weapon. The victims, Alma and Abigail. They both died from being stabbed in the chest by a weapon with the same shape. Their wounds match the shape of the weapon found inside the clock.
Alright, the card definite weapon has been obtained.
The two of them were killed with the same weapon, this handmade stake.
Alright.
Abigail was killed by the stab wound in her chest. The shape of her stab wound perfectly matches the shape of the weapon found in the clock. The bruise on Alma's palm indicates that she had been using the weapon. If Abigail was murdered by Alma, it would make sense for Abigail to respond to a phone call from her mother.
Uh-oh, guys.
There's also Abigail's final words to consider. Huh. Why would she say that?
Maybe she didn't know it was her mother, because her mother was disguised. She didn't know it was Alma. The card is Alma suspect has been obtained.
That's right. The killer was wearing a mask and covered in fur at the time. Even as Abigail lay dying, she had no idea that her killer was her own mother. That's why she called out, to warn her mother away. From the phone call, she would have assumed that her mother, Alma, was somewhere nearby. But if Alma is the murderer, how did she end up killed by the weapon that she had been using?
Dr. Kimishima, the results of our analysis have come in.
Good. Which analysis was this?
The wine glass. Something else was detected in the residue.
Well, what is it?
We've detected traces of benzodiazepine in the wine.
What the hell is that, little guy?
Benzodiazepine?
Mamma mia. Oh no!
Isn't that used in sleeping pills and anti-anxiety medication?
Mamma mia, indeed.
That's right. It seems to have been mixed in with the wine.
Little guy, was there any benzodiazepine found in Alma's body?
No, why? The results of the drug test came up with a negative on that.
That's all right. I just wanted to make sure that she wasn't the one taking it.
Okay.
Solid evidence. Analysis complete. Broken wine glasses become benzodiazepine in wine. I'm gonna fuck up every single medical pronunciation in this fucking playthrough. I already have. Okay, who killed Alma? Who did actual murder? Okay, so we actually are coming down to it because we have a lot of solid evidence here. And nailed it.
If we believe that Alma is the one that killed Abigail, then Alma put the sleeping medication into the wine. The one who drank it was...
Joseph. Joseph had sleeping medication.
Her husband, Joseph.
What do you mean? Are you saying?
That's right. Alma tried to kill Joseph as well.
But, Dr. Kimishima, isn't that just...
The weapon left a bruise on her palm. That is proof that she used the weapon.
But she was killed by that same weapon.
That's true. Let's stay calm and think this through. We have evidence that there was a struggle between Joseph and Alma, don't we? That is...
There's blood on Alma's sleeve.
Indeed. The blood stains are quite likely from when Joseph was injured and grabbed Alma's wrist during the struggle.
Then, did Joseph kill Alma during that fight?
I'm just saying that this is one conjecture we could make.
But there's no motive. The family reportedly got along well.
Little guy, where is Mr. Parker right now?
Huh? He's still being detained.
Good. Tell him something. Tell him we found the weapon Mrs. Parker was using inside the clock.
All right, I'll do that. Where are you going, Dr. Kimishima?
I'm going back to the murder scene. I want to find Alma's motive.
Alright, so let's save. Let's head over back to the murder scene. She's so gorgeous. Like, she is the prettiest one ever.
Oh, Dr. Kimishima, can I bother you for a moment?
Shut up, little guy. We're admiring Dr. Kimishima.
What's the matter?
HQ contacted me just a moment ago.
Just a second. My cat is licking something that he should not be licking. Bubby, you're allowed to be up there, but you can't lick that. Come on. Come on, dude. Alright. I'm taking it. It's in the trash now. Alright. Alright, let's continue. Ba-ba-ba.
It seems Joseph Parker has a message for you.
A message? What kind of message, little guy? Sorry, I'm like getting my blanket situated again because I got up.
The victim's husband? But why?
I don't know. I'll send the recording over to you right now.
This message is for whoever is investigating my case. I don't know who you are, but I'm impressed by your skills. Go to my house and check above the fireplace. My wife's diary should be behind the stones.
Okay.
You must already know that I can't stand, so that's the only thing I couldn't get rid of. If you read it, you might find out what my wife was truly feeling. Please, make use of that information.
Okay, so he's kind of admitting it.
Did you get all that, Dr. Kimishima?
I heard every word. I'll have to check above the fireplace.
Alright.
Above the fireplace, behind the stones. This must be it. Alma's diary is in here? Here it is.
Ah, diary.
I should take it back to the office and go through it.
Alright, let's head back. Oh, hi!
Oh, Dr. Kimishima, can you spare a moment?
I do if it's about the case.
Hey, I know that look in your eye. You're up to no good, aren't you? Hey. my cat, he's so he's not a lot of brain cells going on in this one, but he got up to a high place. He doesn't know how to get down, so let me see if I can get him. He's either meowing because he's, I don't know, or he's meowing because he can't get down. So let's go. Hey, buddy. Okay, he doesn't want down then. Why did you meow like that, boy? Come on. He is like in mega dipshit hours. I was just lounging there. Like, why did you meow like that? You sounded like you're in distress, boy. Was that your like war cry? I don't know.
Of course it is.
He is. It's real dipshit hours every day when I'm living with this little boy.
Good. I hope they find something.
Yes, and regarding the results from the auto-imaging scan, a tumor has been found in Alma Parker's prefrontal lobe.
A tumor?
Yes, it's about 5 centimeters in diameter, and it seems to have been causing CVD.
Oh.
Cerebral vascular disorder. If that's so, then...
Yes, well, even if she hadn't been killed, she didn't have much time left.
That's not the point. Tumors in the prefrontal lobe cause visual and auditory hallucinations.
Oh, God.
There's the chance that this may explain her strange behavior.
Hey, Bubby.
Wait, so you think this is related to the case?
I found Alma's diary above the Parker's fireplace.
What? Then Joseph was...
He was telling the truth. Reading this may tell us more.
I write this diary giving thanks to the mountains and to the flowing waters. My headaches continue today. That bruise seems to have gotten bigger, too. Should I see a doctor?
A bruise? What is she referring to?
A bruise? Huh. Bruise. But I don't know when it was. That's the problem. Okay. Sorry. Sorry, my cat's like starting to act up, so. Bobby. Hey. Hey. Bobby. Alright, I'm just gonna stand for the rest of this. Let's go. Alright, I'm not sure what it is. Bruise on left palm? No.
Concentrate.
Right palm.
That's right. She was still alive when she got that bruise on her hand.
I write this diary giving thanks to the mountains and to the flowing waters. A miracle happened today. I can barely believe it. I heard God's voice, beautiful and pure. The bruise on my hand is a sigil passed on to me by God himself.
Uh-oh.
I see. Well, I'm no theologian, but I doubt this was a revelation from God. What happened to her was caused by
having auditory hallucinations.
Right. Her experience was likely caused by the tumor in her prefrontal lobe. She interpreted the whispers of her disease as the voice of the Creator.
I write this diary giving thanks to the mountains and to the flowing waters. Today I heard a shocking premonition. We were walking the path against God's divine will. My pain was inflicted on me as a punishment and a warning to me and my family. I cannot let this be. I must save my family.
Uh-oh. Oh, God.
I write this diary, giving thanks to the mountains and to the flowing waters. The preparations have been made. I will become the beast of the Lord and lead my loving family. I will sever them from this world and engrave the sigil upon their bodies too.
Okay. Alright. Cool. Cool. Okay, cool.
Abby, my little girl, I willingly become the beast so I can save you.
Okay, alright.
Beast of the Lord. That explains the fur.
I write this diary, giving thanks to the mountains and to the flowing waters. I learned a terrible truth today. My little Abby never reached his side.
The fucking emotes.
It's my fault. I severed her connection before engraving the sigil. Ah, my loving daughter. Please forgive your mother for being so foolish. Joseph will be saved. I will engrave his sigil and lead his soul. I'll make sure it won't hurt. Joseph, let us be reunited in his world.
The diary ends here. Alma died after writing this. The sigil that she says she engraved onto her daughter is...
the wound on her right palm.
That's right. Alma thought the black bruise on her hand appeared as a holy sign.
Hey, Bobby. Hey. Not supposed to be doing that.
That's why she thought she was saving her daughter's soul using the same pattern. She also planned to do the same to her husband. When she said she'd make sure it won't hurt, she meant...
She meant the sleeping pills. Yep.
Indeed. This diary answers a number of the questions we've had regarding this case.
Right. Solid evidence. Wounds and bruise have become two sigils. Abigail's last night became details of Abigail's murder. Is Alma a suspect has become Alma's symptoms.
Until this point, I had thought that Alma and Abigail had been killed by the same person. But now it's clear who killed Abigail. And yet, there are several things found at the crime scene that could not have been Alma's doing. I need to review the information we have to determine if these murders were committed by the same person.
Hey, just a second. Alright, back. Alright, so what do we have here? There's our only one left.
Hey, little guy, I have something else that I need you to analyze for me.
You do? I thought we've already been through everything.
What, did the monitor tipped over? Yeah. No, it didn't. He just kept going.
It's more that I want you to sort through what we know. Alma wore the mask and the fur when she killed Abigail. However, Alma couldn't have done everything herself. For example...
What we know about the case of death that Alma's could not be behind was... Alma's.
Yes, Alma didn't stab herself. And there were obvious attempts to hide evidence after Alma's death. One such piece of evidence is...
burning the mask and fur.
Yes, someone tried to destroy the costume Alma wore in the fireplace. Another piece is...
hiding the murder weapon.
Indeed. The weapon Alma is believed to have used was hidden inside the clock.
Only one person was able to do this.
Yes. Now we can finally see everything that happened in this case.
Alright, so we have all of our solid evidence, so... This is another downer, guys. Same killer has become other killer. Conclusion reached. The case has been solved. Let's put it all together then.
The dead shall speak. Let's put together the truth of what happened here. In a way, you could say Alma Parker is the first victim.
Hey, I want you to sort through what we know. Sort through it herself.
She had a
exactly.
She tumor within her prefrontal lobe.
You know how some people just need to talk at someone?
The conditions caused
That's what she
by the
needed.
tumor changed her. This card has the evidence of that.
The tumor that had this terrible effect on Alma. Almost symptoms.
Yes. She believed her hallucinations were divine visions. Parting with the world. Her beloved daughter was first. It was that same love that led to Alma's attack. This card proves the violence Alma carried out on her Abigail.
The awful thing that Alma did to her own daughter was... Abigail's murder.
Indeed. She put on a mask and fur, then killed her. That's why Abigail failed to recognize her own mother. Instead, she kept screaming in order to warn Alma away. Abigail's last words are proof of that.
Last thing Abigail said was...
Mom! Stay away! Run!
After the murder, Alma tried to guide her child's soul. The proof of that is on this card.
What Alma did to guide her daughter's soul to God was the sigils.
This is likely what Mrs. Bowen witnessed. But Alma thought she had failed to save Abigail's soul. In order to guide the soul to its rightful place, Alma thought the sigil needed to be applied before death. So she made careful preparations for Joseph's murder. The evidence of that is shown on this card.
Alma made this careful preparation in order to kill her husband. Yep, the wine.
Yes, but this plan failed to work. Joseph woke from the pain and struggled with her in a panic. This card tells us the evidence of that.
When Joseph awoke and Alma carved the sigil into his hand, the proof is that he fought against her is the bloodstain.
Alma wore the mask and fur again to kill her husband. That's why Joseph didn't know it was Alma attacking him. He desperately caught her hand, resisting her. And in the ensuing struggle, they fell, stabbing Alma. When Joseph removed his attacker's mask, he realized... It was first thought that both cases had the same murderer. But with so many mysteries solved, I know that can't be. This is the card with proof of the reason why that is.
What proves that both murders could not have been done by the same killer is... Oh. The lie?
Concentrate.
Nope. It's the masked suspect. There we go.
Yes. After Alma's death, someone erased evidence of her guilt. No matter how it was done, it couldn't have been Alma. And so, the truth of this card is brought to light.
The proof that Alma did not commit both killings is the other killer.
This person wanted to hide Alma's crimes. First, her costume was destroyed in the fireplace. The weapon she used was hidden within a clock in the house. Another knife was used to make Alma seem like a victim. This card shows who took this effort to exonerate Alma.
The person who most likely did the thing's gun is Joseph.
Joseph knew Alma was not a woman who could commit murder. Her bizarre acts were a result of her brain tumor. Even then, she still loved her husband and cared about him. Her final words are proof of that.
Even though Alma was affected by the tumor, the last words show concern for her husband. Those are...
Joseph, my love. I'm sorry. I can't save you.
This is the truth behind how her life's light was put out.
Naomi, you have a call from Mr. Parker.
Yes. I was just thinking about visiting you. All right. I'll be there soon.
Will you be all right? If you think there's any danger.
Chief, What do you think love is? A true love in which each thought of the other to the end. That may well have been the integral part of this case.
She is gorgeous. We love her. Naomi. Slams fist on table.
I can't guarantee it's any good. Alma always make coffee.
Thank you.
My wife, she was the best companion a man could hope for. Even when I was stubborn or angry, she still loved me.
Mr. Parker, it's my duty to uncover the truth.
I understand.
You loved her. Even if you'll be misunderstood and branded a killer, you wanted to hide the fact that Alma tried to kill you.
I'd be better off if she had killed me. There's absolutely no way she'd kill me without a cause. She must have had some reason for what she did. Please, if it ends like this, Alma will be known as a lunatic. You have to find out what truly happened to my wife. Please.
Yes, I will. That's my duty. Death comes to everyone. I'm a little jealous.
Oh, there you are, Dr. Kimishima. I was looking for you.
I see. What do you want?
I have the report from the Oxford autopsy.
Tell me all about it, right now.
Right. Her brain tumor was kind of, well, strange.
Strange? Could you be any more vague? Were you actually present at the autopsy?
Well, yes, but it was a condition I've never seen. The tissue around the tumor was black. Nobody knows why.
Black?
Black?
That seems similar to what we've been seeing.
Remove that tumor. I'll have a friend at Resurgam check it. And I want the death certificate made by the end of the day.
You want me to do all that?
No excuses. Get to it right now.
What a great time for an ad.
I'm on
This
it.
death brought to you by...
Veronica's death. An old woman losing her mind. What in the world is going on?
Alright, and we finished up Naomi's fourth mission. Which, another downer. Like, honestly, all of Naomi's missions are complete downers. Like, there's no getting around it. Like, all of the other missions are, like, all full of hope and stuff like, oh, I'm gonna save you. Like, I'm gonna cure you of all your diseases. But, yeah. But, Naomi's was all, like, because they're all murder mysteries, it's kind of what you get from that. But yeah, I'm gonna call it today. I always forget how long Naomi's missions are. Like, I was like, oh yeah, I'll take like an hour. No, it took like 2 hours to get through that one. But next one's probably gonna be even longer because all the missions get a little more complex as you get further along in the game. But that's gonna call it for me. So let's see who we're gonna raid tonight. Alright, who's online? Let's check it. Let me see who's online. We are going to go. We're going to go raid Yumi. Yumi is currently playing The Hot Ones Cause the Most Pain. That is the truth right there. We are going to be raiding Yumi. Yumi is currently playing Genshin. I think Yumi is currently doing the new stuff. So like just a heads up, if you want to play the new Genshin update thing, then I guess watch out as you're raiding. don't want anyone to get spoiled. But yeah, so let's head over there. So my next stream is going to be tomorrow. Every single Tuesday I always do Code Relay's read-through streams with my friends Matcha, Tenten, Muji, and Alex. So we're going to be doing that tomorrow at 8 p.m. Eastern Standard Time. Tomorrow we're actually going to probably figure out which route we're going to be on, so that's very exciting. So yeah, see you guys tomorrow, and for now, let's go say hi to Yumi. Bye guys.